health consultant and andrologist in the field of Ayurveda. Sir has guided 10 PG scholars. Sir has worked extensively on Uttarabasti in the management of sexual dysfunctions and infertility. Sir has presented many scientific papers in national and international seminars. Sir was a resource person for more than 20 main events including national and international. Sir has given radio talk at All India Radio Dharwad and Venudhwani Belgavi on the topics like masturbation, infertility, erectile dysfunction, premature ejaculation, etc. Sir has participated in many live phone-in programs at All India Radio Dharwad. Sir has conducted many reproductive health awareness camps to the public. Sir has initiated postgraduate certificate course in Vajikarana at KLE University's BMK Ayurved Mahavidyalaya. These are the achievements of Sir, and I request Dr. Jairaj P. Pastikidan Sir, HOD Department of Panchakarma, to present poem to Sir. I request Dr. Sukumar Sir to continue the speech.
Thank you, Dr. Pallavi. Very good afternoon, everybody. Om Shri Dhanvantare Namaha. Respected principal of this esteemed institute, Dr. Pallavi, and session invitees, dear delegates, ladies and gentlemen. First of all, I would like to thank organizers for giving me this opportunity and conducting a beautiful event, the Saaphalya 2022. That's absolutely the need of our considering the present scenario. So, however, it is post-lunch session. I will try my level best to keep you all alive. So the topic is concerned with Ayurvedic approach to male infertility. So in the morning sessions, like already you have undergone the female infertility management aspect by veda. So these are the contents, wherein like the introduction and detailed pathogenesis of male infertility, interpretation of Ayurvedic pariksha, and understanding Shukra-Drishti, treatment principles, clinical trials, and few of evidence-based medicines and case discussion. So, considering the present scenario, as you are aware, the incidence is at high rate. That is like earlier, the survey conducted by India Today magazine in India, so it was only about 10 to 15% are infertile, and 1 in every 10 was infertile. But this survey was conducted almost like 5 years back. So every decade wise, there is high incidence. There is like the rate is increasing day by day. And as we know, like IVF centers are mushrooming everywhere. That itself is evidence that there is a huge scope for that, because it is an alarming sign. And why the incidence? Always like we have like the liberty. Everyone has become like high ambitious. The females, equally they want to pursue the degree, everything. And after getting double degrees, they just want to think about the settlement and marriage, etc. So the paternal and maternal age itself, right? is one of the contributing factors for nowadays, because nowadays the normal delivery and the normal conception are forgotten things. So without the aid of the infertility consultant, the conception is very difficult. So that is because of the late marriage and all, right? And the underlying stress factor. Chintanam ati chintana, what we call. So that is the main issue here. And extreme change in lifestyle. So there is a drastic change concerned with like ahara, nidra and brahmacharya part concerned. So that itself is like because all these three are considered as Trivapa Stambhas. So these Stambhas are totally imbalanced. Drastic change in the food style and recipes. We are not following the tradition. What our grandma, grandfather used to take the food stuffs, because now we are attracted by Western kind of the food style. The pizza huts, everywhere you will come across like pizza huts. Okay, the roti money is no more, the pizza hut. So that's what like the extreme change in that kind of simple things concerned with the food or lifestyle changes, right? And or even the thought process, because we are living in extreme, the stressful conditions, right? Because our lifestyle is so hectic, so busy. So these are all the common or simplest the causative factors for it. And sperm count, as I said, like as per the WHO criteria, apart from this 5th percentile value, so every decade there is drastic decline. Earlier it was 150 million, better. Like again they made it like 100 million as a normal value, and later it came to now at present like 30 million is a normal. Even there are other standard laboratories, they are having their own normalcy. So that indicates every 5 years or 10 years, drastically the sperm count is falling down. So considering this, we can, I can say that like one fine day, man will be endangered species on the earth. The nature is going to balance the population explosion or whatever, right? So we are like in the race of like China, but however the nature is trying to balance it. Right? So see, coming to the etiopathogenesis, why the incidence is at high rate. So this is like dvayoh dampatyoh svabhavat sarvakarma parinamatva prajabhirvati bhavati. So what it means, Acharya Kashyapa has rightly said, right? Dampatyoh. So both here like the infertility is concerned with both male and female. Earlier the blame was taken only by the female factor, but both males and females are equally contributing for the infertility. So that's what like Swabhava or Sarvakarma Parinama. What he is trying to convey here, the quotation, in spite of advancement in the science, right? So we are assessing at the level of genes, the translocations or the chromosomal abnormalities or DNA fragmentation index. In that way we are approaching, right? But still there is no answer. Sometimes like unexplained infertility we come across, we are unable to trace the cause, what exactly the pathology is. So that is Daiva factor, right? That is what the Acharya has told, Sarva Karma Parinamatva. It is the somewhat like Karma Phala, what we say, right? The Daiva. That factor is that it is beyond our reasoning capacity. It is Achintya, what we say. So based on that, the Purva Karma Phala, they are going to have the bhagya or fortune, right? So the stigma, the Ayurveda has like narrated very well. So if there is no conception, either male or female, somewhat it is considered a stigma in the society. Nowadays we have become very broad and liberal, but still somewhere it hurts. You can't imagine the pain experienced by the infertile couple. always they used to express in front of a doctor, right? So that time we count. These are the simple things like Pachaya, Ekashakascha, right? Chitradeepaha. The beautiful simile they have given. The infertile couple. So the man is almost considered as like Chitradeepa. You won't get anything, but it is as if he is like that. And Nisprajaha Tranapuli Mandala Purushakrati. Tranapuli in the sense like Dadar Bombay Tiwala. Is equated as that of like Dadar Bombay. And Tranapuli. Tranapatrika is different. Tranapuli is different, right? And Apatishtacha Nagnascha. So Yasya Apatyam Na Vidyate. So this is what these are the similes given for the individual who is not having issue, right? So we will come to the basic factors which are required for the conception and how the process of fertilization takes place with the help of advancement of the science, right? So nowadays like, we have lots of IVF centers and also we have developed with advanced diagnostic modalities, right? Like laparoscopy and all. With a camera device we can we will come to know what has happened inside. So earlier only the Darshana Pariksha, Prashna Pariksha, these were the tools. But nowadays we can visualize everything inside just by inserting a small probe-like device, right? So by that we have come to know that these are the basic requirements for the normal consumption, right? The healthy spermatozoa should be deposited high in the vagina, and the spermatozoa should have changes like the capacitation, acrosome reaction, and it should have a prompt motility factor should be there, right? And the motile spermatozoa should ascend through the cervix into the uterine cavity and fallopian tube. It has to wait there, and there should be ovulation at right time. And after that, the spermatozoa should fertilize the oocyte at the ampulla region of the tube, and the embryo should reach from there itself the process of fertilization starts and cellular division, like, right? So up to blastocyst. So if that stage comes, by the time 3 days will be over, and when it comes to the receptive endometrium, there it will be embedded and properly it has to implant there. Then the process of like the embryo, it starts to receive the nutrients from the mother and it further stages of growth. And that's what like the embryo should reach the uterine cavity, and endometrium should be prepared by estrogen, progesterone, right? And there should be proper implantation, and the corpus luteum should function adequately. So these are the basic requirements. You know, if anything fails in this factor, then there will not be any normal conception. So next we will try to trace what has been explained in the classics, so that all these concepts are explained in Charaka Samhita or in other texts or not, right? So this is what the Charaka's concept of fertilization. Purushasya anupahata retasaha, right? So what he tells like what we need, sampat, right? Rutu, Kshetra, Ambu, Bija are required. Rutu, Kshetra, Ambu and Bija. These are the 4 essential factors which required for the normal conception. The same thing is explained here. Purushasya anupahata retasaha. Retas means there should not be any seminal abnormalities, right? From the father side, right? And Striyacha apradushta yoni chonita garbhashayaha. There should not be any anomalies or deformities or defects in the yoni pradesha, and the same like female gamete own consent and garbhashaya, anupahata garbhashaya, in the sense the uterus, like, so ashaya should be free from disease, like there should not be any large space occupying fibroid uterus or any polyps or growth or septate, right? Anatomically it should be in a good manner, right? There should not be any congenital anomalies even. So that's what like anupahata, right? It should not be affected by either anatomically or physiologically, right? So that's what. And yada bhavati samsargaha ऋतुकाले. They have not they had adequate knowledge about the fertilization time. Right? ऋतुस्तु द्वादशरात्रं भवति. ऋतुस्तु षोडशरात्रं भवति. These are the two expressions given. Either ovulation occurs on the 12th day or 16th day. Likewise, in that time period, they were very much aware about it. Right? So that's why they have advised the couple to take a chance starting from the 4th day to 16th day. Right? That is what the advice given by Acharyas. Odd days and even days for male and female, you know that concept. So that's why yada bhavati samsargaha ऋतुकाले, during that ovulation time, if the couple take a chance at right time, then probably there is chance for normal conception. Samsarge Shukra Shonita Samsargam Antargarbhashayagatam. That's what, where exactly the zygote formation takes place? Inside the uterine cavity. The fallopian tubes are also part of the uterine cavity. As a whole, Garbhashaya what we call. That is what Bhavo Yonihi. Yoni is again like Tasyaha Tatyet Vavata Garbhashaya Pratishtitaha. So Garbhashaya is situated in the Tatiya Avarta of the Yoni. That's what Antargarbhashayagatam, the normal conception takes place, right? And Jivo Avakramati, Sattva Samprayoga, Tata Garbho Abhinirvavati. So this is well narrated in Kundika Garbhavakranti Adhyaya, right? So where there is like we are going to call Shukra, we are going to consider it as like Rupa Dravyam Taduchate. Rupa Dravya is nothing but it is going to provide a Murti or Akara for the Atma. That's what like Atma concept, the Atma Pravesha takes place, and with the entry of Sattva, the Manas, then the fetal sac becomes like flickering with cardiac activity, and from there the process of normal process, the like development stages starts. Yes, that's what like Rutumati concept and Rutukala, right? So they had idea regarding like these terms are synonymously used for Shonita, Artava, right, and Raja. Okay. So no doubt like Raja, Masena Upachitam, Kale Damanikyam, Artavam, Vayor, Yoni Mukam Nanit, they have told. So that is like previously the stored, right? The endometrial bed is going to set Masi Raja, Shuddhanti Narinam Straya. 3 days closed, they have told, right? That is what like 3 to 5 days the normal menses, they had right idea. And after that, Gate Purani Rajasi, Navecha Avastite, Shuddha Snata Striyam, O Apanna Yoni, Shonita Garbhashayam, Rutumati Machiksate. So Rutumati concept, so even like Pina Prasanna Vadana, Prabli Natma Mukhat Vijam, Swasta Kukshakshi, you know that. So that how to assess the Rutumati when she is ready for the normal conception. Narakamshini, they have told. Okay, so all these are the signs given or clues given by the Acharyas, right? So that's why, so after once the menses cessation occurs, after 5 days or 3rd day onwards, the 4th day, 6th day, 8th day, likewise, if they take a chance, there is scope for normal conception. Why? Because the modern science tells like a healthy spermatozoa can wait for maximum 72 hours, right? Once it is ejaculated, right? So, but we have noticed, then a query arises in my mind while doing postcoital test, PCT. So, if that is the case, Acharyas have told on the 4th day itself, if they take a chance, still there is a chance for normal conception. But whereas the ovulation is going to occur on the 14th day, right? They have taken chance on 4th day, but 10 days they are going to survive. In one of the case, when the cervical mucus interaction study we were doing, so the cervical mucus was taken on the 14th day, and they had taken chance, and the partner was outstation, and on the 14th day also, we noticed a healthy spermatozoa in that cervical media. Then I just like came to know the sperms can live more than 10 days also, provided the cervical mucus is non-hostile. It is infection free, and it should be nourished with abundant the fructose etc. Right? So then there is chance. The Acharya as well, right? Even on the fourth day also, if they take a chance, if the seeds are good, there is chance for a normal conception. It's not like only on the 12th day or 14th day or 10th day, right? That's clear. Yes. So they have told Bija Rupo Dhatu. Always like when we call Dhatu, like it is, the concept is we indicate with that of only semen. But the semen is right? There is like views for concentration density. That's why like it is going to attain the gunas like bahalam, thickness, the opacity comes for the semen. Otherwise it becomes mere water. So that's why Bija Rupo Dhatu, Anga Danga Sambhavanti. So why we are going to call it as Bija Rupa? Because it is carrying the genetic makeup of one individual to the another, right? So that's what like 22 pairs of like the chromosomes and again the Y chromosome. Okay. So that is what like genetic makeup required. So that is the reason why it is also called as Rupa Dravya, right? Apart from Chatushpata, it is called as Rupa Dravya. It is taking or carrying the genetic makeup which is required for the normal conception. See, the fertilization again, like they have explained. Harshabhutena Atmana Udinitascha Adhishtitascha Bija Rupo Dhatuhu Purusha Sharirat Avinispatya Uchitena Pata, right? Garbhashayam Anupravishya Artavena Avisamsargam Eti. This is what the zygote formation, the process of zygote formation, like here you can notice the ampullary part of the region, like fertilization, how it occurs. The same thing is explained in this quotation, right? Purusha Sharira, Abhinispatya, the ejaculated semen enters the cervical canal and the quality seed enters the Uchitena Patena. There should not be any blockade in the fallopian tubes. Pata means passage, right? So if that patency, normal patency is there, then that seed, that is like spermatozoa, is going to reach the ampullary region and Garbhashayam Anupravishya Artavena Avisamsargam. It unites, that is the zygote formation takes place, right? And what are the principal components of the initial evaluation? Once the couple come to us, so we need to have a complete medical history, right? And the thorough physical examination is required, and if required, we need to go for hormonal evaluation, right? So clinically, it is possible to evaluate certain hormonal estimations, but however, if you want, you can go for serological investigations. So majority of the things are known by the Prashna Pariksha, because we know what we mean by Prashna. Prashnena cha vijanam kalam atanka samutpatim vedana samuchayam, right? Vedana samuchaya, whatever like the history of illness, the present illness, and what has happened, kasmin deshe jataha, kasmin deshe vyaditaha, likewise. So everything we will come to know by the Prashna Pariksha. So here by Prashna Pariksha, we will have adequate knowledge regarding their sexual frequency, and are there any related with their normal sexual life, healthy sexual life is concerned, and we will come to know regarding the menstrual history, and also we will ask regarding the medical history, whether they have already diagnosed case of certain metabolic syndrome or thyroid issue, right, or any other conditions, and surgical, if at all they have undergone any the surgical interventions previously for pelvic area, pelvic region, and the family history. Is that the tendency of delayed conception is there in the family, or what? Whether their parents already taken treatment for IVF center or what? In that way, we need to trace the history, and also the previous infectious, repeated infections. If they are suffering from any of the infections, by Prashna Pariksha we need to confirm it. And also we can ask something regarding the childhood history. The childhood history, the repeated mumps history, because one of the complication is like mumps, arthritis, etc. So likewise, any sort of repeated infectious disease, if we notice, then however, probably it helps for us. Because of that, is there any chance of affliction of the germinal layers in the testicular tissue? In Moolasthana, Shukra Srotas Moolasthana, whether the germinal layer is affected, whether it is a case of maturation arrest, whether it is a case of primary testicular failure in childhood, whether it is a case of secondary testicular failure, right? If maturation arrest, at what level? Okay, so likewise, it helps for us. The history itself gives an idea. Based on that, you go for the hormonal evaluation, and after that, if at all you want to confirm it, you can go for the testicular biopsy, etc. if the patient is consenting, right? So, coming to the factors as per the modern science, so this is we can categorize into two headings. One is like arrest of the production of the sperm, that is under the sperm factors. This is like arrest. So here like spermatogenesis is arrested, right? That is possible in case of primary testicular failure or secondary testicular failure. Apparent normal production but subsequent deterioration. So here earlier there was the normal reports, the patient is having the normal reports previously, but now he is having the reports of severe oligospermia likewise, or he might be come with azoospermic report, right? So there like we can suspect the secondary testicular failure, and that may be possible in case of a rise in intratesticular temperature. Like the testicles are kept outside the body, because testicles, they are having the normal thermoregulatory mechanism. It is as if like it is having its own AC, right? So whenever in extreme summer it descends, right? Whenever extreme cold comes, like it may be taken towards the umbilical, right, inguinal canal, right? So that way, like otherwise they would have kept well protected beside the kidneys as the retroperitoneal organs, right? So that's why the temperature issue here. Testicles require 3 degrees Fahrenheit less than the normal body temperature. So that is the reason why like youngsters, the macho style, skin type genes, etc., they are not good for them. So what we suggest is like the open, the dhotis, etc., what earlier like they used to wear the traditional wear. So that is the most required for the normal spermatogenesis, right? The tight inner wears or undergarments or jeans, etc., are not good for the male especially. And inflammatory and infective factors, right? So also for the subsequent deterioration, these are the two factors: the repeated infections, and the infections may be like even from simple UTI infections to it may go to tubercular infection, right? So immunological changes sometimes, and in such conditions we can go for like estimation of anti-sperm antibodies and all. And coming to the environmental factors, here like toxic agents, occupational hazards, and environmental pollutions. So there are lots of toxic agents nowadays. The simple things, the coloring agents, right, in certain grains and food recipes, right, whatever like gobi manchuri, etc., we call the beautiful color, what it comes there, that is, they are highly carcinogenic as well as they are going to cause the teratogenicity in the testicular tissue, right? So that's why they are toxic agents, right? So to highlight this issue, they have given again the beautiful quotation: Yata bijam akalambu krami kitagni dushitam na virohati sandushtam tata shukram sharina. So in the natural environment factors, how it is affected by the natural calamities, in the same way, if any change, if there is change in the body chemistry, it is having direct impact on the seeds, the functional seeds, because Garbhotpadana Mevacha is the karma attributed for the Shukra Dhatu. Shukra is Saumya. Anything, the chemicals, etc., extreme temperature or Tikshna Ushadi, whatever you take or any chemicals you ingest, so that are having impact on the Saumya Dhatu. So that is going to lead the morphological defects in the spermatozoa, etc. That is what the quotation holds good here. So we will try to trace the Nidana factor as per in the Ayurvedic way, right? The modern etiologies, you know, right? So if you want to understand the magnitude of physiopathogenesis, the Samprapti, we have to screen the individual for Shukra Pradosha and Shukra Dushti we need to understand, and Bija Dushti we need to understand, the Klaiva and Apraharsha, right? So each context and even the set of karna, if we understand properly, then it is very easy to assess the physiopathogenesis which is meant for male infertility. So here, for better understanding, if the patient comes with a seminal report, so there like we are going to assess the viscosity factor, pH factor, and fructose, presence of fructose, and microorganisms, any infections, and autoimmunity we are going to assess, right? So in the same way, we are going to assess in another way apart from Retopariksha. We will come back to Retopariksha in later slides, but here additionally the Acharya has given other clues for the better understanding. That is, one is Apraharsha. There are two conditions, Aharsha and Apraharsha. Aharsha is Dvajotani Satyapi Maituna Samartaha. That there is erection, but still the patient is unable to perform the sex. So that is like if you advise, you have to take a chance on 12th day, 14th day. Sometimes like few will say like we are having issue in keeping the contact on the scheduled dates. That may be because of like it is related with their like aharsha. It is the attractiveness, or there may not be any the fascinating woman or non-cooperating woman. There may not be the willingness sometimes. Maybe aversion, right? So these are all the things which are going to come under the aharsha. Whereas apraharsha condition, it is three vishaya anabilashaha, ananda bhavaha, they have told. So this indicates there is like a loss of sexual desire. That is libido. They have explained libido here by apraharsha. And ananda bhavaha, it indicates failure to reach the orgasm. As per Dallana is defined in the commentary, orgasm is, that is like ananda bhava. So if the couple fails to reach the orgasm, then also sometimes may not be any conception. And Klaiva factor in Yoni chapter beautifully explained the varieties, like, right? The four varieties of Klaiva. These are the Joka, Gatavram, Jaya, Shukra, Samsya, all four varieties explained with treatment. And another is Tirashukranimiti, that is androgen insensitivity. So this may be related with celibacy, or it may be because of infrequent intercourse, long gap. So in such case, like stored spermatozoa, sometimes they become insensitive, right? Yes, again like ejaculatory disturbances. Here, if the person fails to ejaculate high in the vaginal area, sometimes like there is a hurdle for the normal conception. So that is maybe because of vakri. Vakri in the sense like vakra dvaja, vakri yoni apat is also there, right? Twisted or cervix or cervical. Sometimes near speculum examination you will not find the cervix or canal in normal situ. Similar way, that is vakri can be indicated with Peyronie's disease. It is a curvature disorder of the penile tissue, and either hypo or epispadias. So there also difficulty in normally ejaculation. And Vimarka retrograde ejaculation in case of BPH, etc. Benign prostate hyperplasia, where like prostatic part of urethra is obstructed. So because of that, the ejaculated semen will not come out at that time, but instead it enters the bladder while micturating along with urine. As a putra sutra, it comes out. And So, Baddha Shukra word has been used, and that holds good for obstructive azoospermia, right? So, there the ejaculation occurs, but it is devoid of sperms, right? Spermatozoa zero. And Shukragatavada, it is ejaculatory dysfunction again, either early or delayed ejaculation, right? There is no timely ejaculation. So, as per the examination is concerned, Ayurveda always focus on the Pratyaksha Pariksha, right? So that is like Darshana, Sparshana, Prashnaihi, Pariksha, Tata Roginam, they are told. So by Darshana Pariksha, that is naked eye examination, we will come to know whether the adequate secondary sex characters are there or not, right? So like mustache, beards, pubic hairs, underarm hairs, all these are like what we consider as a Shukra Mala, right? So that reflects the underlying the metabolism of related with androgens, right? That indirectly it gives idea regarding the circulating androgens in his body. That's what like if the testicles by palpable by manual examination, if the testicles are very rudimentary, very smaller in size, right, or hypoplastic in nature, by that we will come to know, right, how well the gonadal genesis is there, or if the testicle sometimes may be absent or may be missing, one testicle may be missing likewise. So this simple naked eye examination, we will come to know whether the patient is having lots of other infections or any venereal infections are there, skin manifestations, tinea, right? If you suspect something, HSV, etc., you rule out. Herpes simplex virus, etc., right? Even in case of females, like usually we advise Parch panel, we advise for confirmation. Viral sometimes interfere with the normal conception. So likewise here for the male, whether the patient is having the phimosis or whether the individual is having any underlying hydrocele or direct inguinal hernia, or whether varicocele is there, underlying varicocele, right? So varicocele sometimes it alters the count as well as morphological defects are very common because of the temperature issue. So simply we can estimate the size, even size they have told in Pramana Sharira, right? Like the size of the penis is Shadangula Dirgha, Panchangula Parinaha, likewise. On an average, it is expressed in terms of ml, right? So usually like 25 or 30 ml is the normal optimum size what we consider for the Indians, right? So this helps us, the simple this examination helps us better understanding Shukra, Sarvadayika Shukra and Sthanika Shukra, right? And Retas, Bija, Kumbija, right? So these are the words, and again like Shukra was Rotas and Shukra was Kala, right? And Shukra was Shira. These are mentioned. So this gives a total idea about the anatomy and the physiology and also the vessels related with that, right? And the testicular tissue, what we consider like that is mainly meant for epithelial, germinal epithelium, which is there in the testicular tissue. That's why they have considered it as a Moolasthana of Vashanaucha, right? They have used the word Vashanaucha. So even they have a link under it, right? Now, even like from the ducts, Mullerian ducts, etc., how there is link is there for the breast as well as Aparamcha, Avchiyamana, Urdhva, Magata, Stanayor. So that quotation gives a link how the gonadal function is under the influence of hormones, right? So that is the idea, indirect idea we are going to get by these quotations. And the germinal epithelium, that is in the testis, and Rupa Dravya, what I said, seminal vesicle, and once the healthy spermatozoa released, the spermiogenesis is different, spermiogenesis is different. Spermiogenesis undergoes in epididymis. Shukrivoti, what we call, right? That is for spermiogenesis. Aharasya param damaha shukram, tasmat yatnena raksham shukram. So it's the finalmost component of whatever the food we consume the essence of the nutrients is there in the semen, right? The millions and trillions of spermatozoa in a single drop. So that much of because they are the basic required for the all sorts of immunity, right? If that is lost, right, then the person is going to have some sort of deficit, the immune complex. That's what they have told in the context of Raja, right? The Pratiloma Dhatu Kshaya, etc. has been told there. And yes, by simple examination only, we will come to know if the patient is having severe tenderness, right? And if the signs of inflammatory signs are there. Whether orchitis is there, whether epididymitis is there, or epididymo-orchitis is there. So that has been explained in the classics as a kuranda, like testicular swelling with tenderness and associated fever, etc. So that may be usually this epididymo-orchitis is because of the underlying infections like chlamydia or tubercular infection. So similarly, those infections are traced by TB-PCR. And if the blockade takes place there, in that particular epidermal, it leads to cyst. That is, we call like they are epidermal cysts. Sometimes they are bigger than the testicle. There is a pouch or bag filled by the sperms. But when you examine the individual for semen analysis, he turns azoospermic. But if you go for the aspiration from this cyst, then you will have MESA and PISA technique, etc. At that time you will come to know the abundant sperms. So it indicates there is obstructive azoospermia. So while ruling out the obstructive azoospermia, usually this has been screened with the help of testicular scan. Also you will come to know this, the large side or small side, bilateral or unilateral epidermal cysts or notice. Sometimes we are able to dissolve these cysts and clear the passage by simple medications like Shivagutika, etc. Right? If even after medication and Shodhana, Virechana, etc., if the person won't relieve, right, then you can advise the surgical intervention for the better outcome. Yes, this is all. And again, like as I said, like the complication, mumps arthritis, right? So in the childhood, but not all the individuals are going to have this complication of arthritis. Few individuals will have arrest of the spermatogenesis. It leads to primary testicular failure because of the infectious pathology. And alpa shukra, right? Alpa kshina vishushka retasam. In the definition of Washington itself, as they have told, right? So there, like the alpa shukra, it is related with primary hypogonadism, hypogonadotropic hypogonadism, because there is no proper growth of the gonads and there are no any sex characters. The feminine kind of fat distribution in the pelvic area, it indicates there is underlying hormonal deficit. So Anand, according to Narada Maharshi, he has classified Klaidya and Shanda into 14 varieties. Narada. So there in that classification, Anyapati, Ekanda, Anandascha, he tells. So Ananda, it is like failure to descend to the normal scrotal sac. So immediately after birth, there should be descent of a testicle. So if it fails, then one has to undergo the orthopexy surgery, right? So in later phase of life, the surgery is done and they are brought to the scrotal sac. If left there itself, sometimes they turn into malignant, right? Sometimes. So this is what like cryptorchidism. We call it as cryptorchidism. So many times, commonly, the left-sided varicocele is very common in all individuals, right? So that is because it makes a 90-degree arch and it directly drains in the left renal vein. So that's why it is common, varicocele is common on left side. Whereas the right side, it will not be drained in the renal vein, directly it will be some other, right? So So we are going to call it as like either Andavritti or Sirasya Granthi kind of pathology, right? Any Shota, Prashana Shota, Shopa we notice, Vritti we notice, right? Or Puranda we notice. So in that category we have to. So here clinically, like we can categorize into grade 1, 2, 3, 4 grade. So up to grade 2 it is like sonologically, subclinical. Whereas clinical, grade 3 and grade 4. Grade 3 is palpable, it feels like one-pill bag appearance, right? So as if like in a leather bag, the Indra Gopa, it feels like that, right? So that is called as like one-pill bag appearance, okay? And grade 4 is visible from outside, with mere Valsalva manner, right? So simple coughing reflex only, you will come to know the varicose. So this is how it helps for the differential diagnosis here. One thing, how to differentiate obstructive and non-obstructive azoospermia. Many times we will have confusion for this. Patient comes with azoospermia report, at that time what to consider, whether it is obstructive or non-obstructive. So at that time we need to go for estimation of gonadotropin, testosterone and size of the testicle, right? That helps for obstructive and non-obstructive. That is, in case of obstructive, FSH, LH, testosterone and testicular volume all are normal, right? Whereas in case of non-obstructive, right? So primary testicular failure is there. FSH level is raised highly and LH is raised, whereas testosterone level is reduced and size of the testicle is also hypoplastic. So that indicates primary testicular failure. Whereas in case of hypogonadotropic hypogonadism, so all are down-regulated, right? So that's why this helps for the differential diagnosis. And again, if the patient turns azoospermic, the report is no spermatozoa, but volume of the semen is also very less. There is no, by Prashna Pariksha, we will ask the patient whether spillage is there while collecting. If he tells like no spillage, only the quantum of semen which is obtained after masturbation is only this much, then we screen for, individual is screened for this because of the low semen volume azoospermia. That is whether the patient is having the cystic fibrosis, right? And whether there is any retrograde ejaculation is there or total unejaculation is there. So likewise, we have to screen the individual for better understanding. And whether testicular or obstructive, this is what the case incidence. The 2% of the cases with low FSH and normal FSH case is 60% and high FSH case 40%. So it is like low FSH means like a pre-testicular cause, and where normal FSH testicular biopsy is needed there, and if high FSH there, like it indicates the testicular failure, right? Yes, this is a simple diagnostic evaluation. Basically, we depend on USG scrotum, that is enough for us, right? And sometimes we go for like transrectal sonography and truss-guided seminal vesicillography, seminal vesicle duct, whether it is blocked or what. And sometimes like we need USG abdomen also to trace undescended testicle, etc. And cranial imaging studies are required if you want to rule out how well HPT axis is balanced, hypothalamo-pituitary testicular axis, right? And these are the lab investigations basically required for semen analysis, the Reto Pariksha, right? So that is basically required. Nowadays, like every center is equipped with CASA, computer assisted semen analysis. However, the software is a bit costlier, but helps to overcome the bias, right? And FSH, testosterone and prolactin hormone are basically estimated as a part of hormonal assay. And if required, one can go for anti-sperm antibody. If the immunological basic is what? Agglutination is there in the semen analysis. If the sperms are agglutinated head to head and tail to tail likewise, then you can go and advise anti-sperm antibodies for the confirmation of immunological cause. So by that you can simply helps to when to use like Amrita Prashikrita, when to use Guruchi Rasayana likewise, right? And if previous history of repeated abortion or miscarriage history is there, better to advise DNA fragmentation index or karyotyping study if previous history of MTP etc. is there, so that here like addition or deletion of the chromosome Vijaydushti can be ruled out. And at last like testicular biopsy helps for the normal differentiation and to confirm the maturation arrest at what level. Yes, coming to part, right? So core part in the sense like we need to understand the samprapti here. What is samprapti? निदान सेवनानन्तरं व्याधेः उत्पत्ति पर्यन्तं दोष दूष विशेष व्यापार संबंधः संप्राप्ति. That is what like detailed etiology. So that has to be understood here. Till now like we just noticed the etiology nidana factors. Now the samprapti factors. Because of those etiologies, what exactly happens here? See, shukra pradosha, dhatu pradosha, rasa pradosha, rakta pradosha, likewise dhatu pradosha. Right? So last dhatu shukra pradosha, klaibyam, aharsha, shukrashvarim, shukra meha, shukra doshadayascha tad doshaha. Right? So few factors already we have discussed. And here like aharsha, stri vishe, anabhilasha. So likewise, klaibyam is sandhata. If the person is having sexual dysfunction, male sexual dysfunction is there, they cannot keep the contact in a scheduled time, and that's why sometimes it helps. It is one of the hurdles for normal conception. See, next coming to the effect on fertility, how it affects. Shukrasya doshat klaibyam aharsham. This is Charaka's version. Rogi va klibam alpayur virupam va prajayate. If the semen is severely affected, the individual becomes very much ill, rogi, and klibam, he becomes impotent, right? He is not sexually potent, and alpayur, even he will have early aging features. Virupam va jayate, he looks somewhat, his hair turns very much grey earlier, and he develops total patient look. Because that's what tasmat yatneya ruksham raksham shukam may have told, right? And such individual, if the same thing like if the shukra dhatu is affected, if that kind of affected semen is contributed for the conception, what will happen? Nacha asya jayate garbha. Even after taking repeated chances, there is no any fertilization. Because if the semen is affected, hence the underlying seeds are also affected. Okay? The spermatozoa is also affected. Hence there is no normal conception. Not just a jayate garbha. Patati prasavate. Either it leads to abortion or miscarriage. Chaturtha, tato masa, garbhapata, and panchama shashtra. Again it is like garbha. Okay? So garbhapata. Patati prasavate. So that's why if the healthy seed is not there, right? If the spermatozoa is affected, right? It is going to lead either abortion or miscarriage. There is no any continuation of the pregnancy. Okay? Shukram hi dushtam sa patyam sa apatyam sa daram vadate nanam. You need to understand the meaning of these two words. What are they? One is apatyavada and dharavada. Okay. So apatyavada means here look at the commentary. Dushtam sa apatyam. Apatyavada. That is rogi klibadya apatya janakatvena. So it is going to contribute for the either kleba individual, right, or fetal anomaly. Apatyavada. And Dharabada means Dharabada to Sravi Garbhadi Jarakatvena. Right? So it leads to repeated abortions. So that's why always it is not good to blame only the female. You are having the problem, you only go to hospital. I don't have any problem. Male tendency. That should not be there. Majority of the both are equally contributing for the infertility. The 50% causes, that's what even the abortion etc., miscarriage etc. are possible because of the affected spermatozoa contributing from the male factor, not the female one. Right. Next, come to the Shukravatavata. Right. So here, Shukravevo, Adivevo, Nishpalatva Shukrage. See, try to understand the word Nishpalatva. If Shukravatavata condition is there, then also there is no conception. Right. That is either it leads to ejaculatory disturbance or it leads to there is failure of conception, right? Am I audible? Yes, thank you. So, Shukravratavata, previous slide. This is Shukragatavata, right? Gatavata concept. So, Vata related, Gatavata. So, here, Apravrittihi, Pravrittirva, Vikrita Shukrage Anile. What it means? So, apravritti, either there is like delayed ejaculation or early ejaculation, that is premature ejaculation, right? Or vikrita. Vikrita means, see, by the word vikrita, Adishigra, Adimanda, Gratita Vivarnadi, Gratita, right? So, semen means almost like as if like coagulated, and Vivarnadi, sometimes it is discolored. Right? So that is what the Shukragatavata factors. We all notice, all these pathologies are practically we notice while doing semen analysis. See, this is what the beautiful Nidana factors highlighted in the classes. What are the Nidanas? If you go in terms of like modern, apart from the normal nutrients, right, or deficit of the nutrients, and certain infections or congenital or anatomical deformities, they don't have this kind of approach. But here, the Nidana factors which are highlighted are Ativavaya. Ativavaya means here it is like excessive sexual intercourse, Vyayama, the excessive work, and Asatmanam Sevana, the food which is not congenial for us. Akaleva api ayurvano maitunam. If one fails to follow the Brahma Dharma Palana, the healthy sexual code of conduct explained in the classics as per the season, right? Every animal is having season, but not man is not having any season, right? So that's why Akale, right? So if that time or if that season is due respect is not given, that is Akale, right? And api ayurvano. Right? Apart from the normal phenovaginal intercourse, if the person is doing like either oral sex or sodomy or other type of abnormal sexual perversions, right? Then Maitunam na chakachataha, either total abstinence from the Vyavaya. The forced celibacy is also not good. The sperms are having like lots of morphological defects and they are insensitive, androgen insensitivity, and defects will be there, motility will be less. If the couple are having regular sexual intercourse on specified intervals, then absolutely the motility factor is good, the morphology is also less, defects is also less, right? That's what they have told. Akale and na chagachata word. Okay. So narinam arasatnya. So this is like if the lady is not impassionate, right? So the should be like, you know, the concept of like Kalini Stri, etc. Okay? Or Pushyatama Stri Lakshanas. Atva Antum Ichata, that should be there. But still, if there is aversion, if the partner is not cooperating, right? That is Narinam Arasajnanam. Arasajnanam means she is not well versed with Kama Shastra. Kama Shastra Chaturshashti Kalas, 64 Kalas. Hava, Vava, Vacho. There are lots of, we can go through that, right? So if that is there, then also, and Gamana Jaraya Stri, if the lady is too much aged, right? If one performs intercourse with such a lady, then also there is severely depletion in the Shukra, semen is, right? And again, another like Rasava, Clivia and other conditions, these in Rasava Suraka Dೃಷ್ಟಿ because Rasava is Rasa is also Saumya Dhatu, Shukra is also Saumya Dhatu. Any direct impact on Rasa directly affects the Shukra. So that's why they have told like these Chintyanam cha ati chintana, this stress, worry, hurry, worry, curry, what we call, right, are directly influencing these Saumya Dhatus. So there will be a reduction in the seminal factors, volume is also reduced, and the quality seeds are also lost, right? And Akala Yonigamanat Nigrahat Ativaituna. Nigrahat, Vegadharana. Vegadharana is like, Adharaniya Vegas. Okay. So Vegan Nadhare, Vata Vidmutra Kshodra Kshudam, Nidra Kasa, Sramasrasa, Jamba, Asrucharti, Retasam. Reto Vega is should not be done. Because Shukra Vega Nigraha Shandya Karana. If you go to the Agre Sangraha, Shukra Vega Dharana leads to Shandatva, Shandya Karana. That's why that is one of the etiology here. And also Shukra Vahini Dushanti Shastra Ksharakni Vistataha. While performing surgeries, right? Many of the injuries, either vessels or nerves or arteries, okay? And improper application of Kshara, etc. However, like Guhyasthana or Dharma is told, and one should have to be very cautious. By mistake, if like applied, it leads to. And by the word Asatmyanam cha Sevanat, what is that Asatmya? What to consume and what not? Right? So that is like Ruksha Tikta Kashaya Ati Lavana Ushna Sevanat. Atyushnam Balam Hanti. Right? Lavana Rasa Ati Sevana leads to Dhatu Shaitila and Vishandata. Right? Ruksha, Ati Ruksha Sevan Palakshaya. Okay. Tikta Rasa Ati Sevana, it leads to Shukrakshaya. Kashaya Rasa Ati Sevana leads to Stambhana and Soto Dೃಷ್ಟಿ. So that's why these simple logic, if one try to understand what kind of food recipe I am consuming, that helps, right? And nowadays, considering the congeniality, patya, what we call, right? So, Dushish and Dharavisha concept comes here, right? So that is like every food articles and today's milk what we consume from dairy, ಹಾಲು ಕುಡಿತೀವಲ್ರಿ, ಹಾಲಲ್ಲ ಅದು ಹಾಲ, right? So it is a poison, right? So you all are aware, many times you all read many articles in the newspaper, right? So they are rich in pesticides, they are rich in certain chemicals, right? So that's why we can consider the concept of Gara or Dushivisha here for the teratogenicity or for the change, the affliction of the germinal epithelium in the testes. These kind of food articles are like coloring agents, right? And certain repeated medications like antibiotics, etc., penicillin kind of derivatives, they are going to arrest the normal healthy spermatogenesis, right? So for many of the autoimmune disorders nowadays, like regularly the patient is put on certain medications, right? So they are having negative impact on the, that is gonadotoxicity, it leads to gonadotoxicity. And even like a simple this dichromochlorpropane, that is 5 fumigant, the commonly like farmer for agriculture this thing, they use it. And every vegetable nowadays, every fruits what we consume, very fresh fruits, they are rich source of. For all my infertile couple, sincerely I advise not to take very good, very shiny vegetables and fruits. Fruits only Sitaphal, right, and pomegranate. Dalimbe matte rest all are what Draksha, Ambra we say, they are totally dipped in chemical, right? There is use, right? So that's why we need to be very cautious while consuming the food articles, or grains, or pulses, vegetables, so many. Yes, Samprapti. So Nidana Purvak Samprapti. Even we have not left the Chinta factor. Chinta, Shoka, Avisrambat, Shastra Ksharatmi Vipramat, Bayat, Krodha, Avichara, Vyanibihi Karshana, severely debilitating disorders, metabolic derangements, right? And Vegagata, Shatachapi, Dhatunam, Sampurushana. So, by this kind of this, what happens here? Dosha Patak Samastava, either a single dosha or Samsarga Samipata together, Prakopa takes place. Prapya Retovaha Siraha, they enter the Shukravas Rotas or Reto Sira, Shukram Sandushayati Ashu, and they affect, right? And they form the seminal abnormalities. Seminal abnormalities in the form of what? Ashta Shukra Dushti. Right? By that Samprapti that leads to 8 varieties of Shukra Dushtis. That may be because of Vataji Shukra Dushti, Pittaji Shukra Dushti, likewise 8 varieties. Here, one more thing we need to understand for the better management, hormonal and seminal deficit. Whether that is Saaphalya or Sthanika. Daurbalyam Mukashvasya Pandutvam Sadanam Sarmana. Klaikam Shukra Avisarvasya Ksina Shukra Sarvasya. So, simply they have given Ksina Shukra Lakshana also. Ksina Shukra Lakshana explained in this quotation is Sarvadayika Shukra Lakshana. If the circulating androgen deficit is there, serum testosterone, it indicates the low level of serum testosterone. All these Daurbalya Mukashva Pandutvam is because if you go to the normal function or normal physiology attributed for the Shukra Dhatu is, right? Shukram, Dhairyam, Chavanam, Preetim, Dehavalam, Bijatam Cha. Right? These are the 4 factors attributed for Shukra Dhatu. If that is reduced, Shukram Paurusham Ityuktam, Shukram Viryam, the Virya component or Paurusha component, if that is the serum testosterone level is reduced, then the person loses. He becomes timid. He will have performance anxiety, right? And he will develop libido. That is loss of libido, right? And then he will repeatedly come to the doctor. This happened, that happened, and he will somewhat like do whatever like earlier, right? So that indicates the hormonal deficit. Whereas Shukrakshe major prashana vedana अशक्तिर मैथुने चिरात्मा प्रसेकः प्रसेके च अल्परक्त शुक्र दर्शनम. So that is, this is because of Ativavaya etc. This is Tanika Shukra Kshaya. It is like the gonadal secretion is reduced here, right? The testosterone, seminal cycle, like this the gonad glandular secretion is reduced here. Here the patient is going to have only semen a drop 0.5 ml or hardly 1 ml ejaculate, and that sometimes it is even divide of seeds, azoospermic. So that indicates Stanika Shukrakshaya. What the idea? This is what like hormonal deficit and seminal deficit. Again, Shukrakshaya can be understood in the 3 headings. Actually, the explanation which is given by the Acharya is much more than the modern parameters explained so far. When I went through the certain andrological aspects and the modern pathology explained in various books, I thought the explanation is much more in Ayurvedic classics what I felt. So this is like abnormal or deficient functioning of the testis in terms of synthesis of the testosterone And another one is related with hypospermatogenesis, what I explained in the previous sloka. Alparetas, the word alpakshina visuskaretasam, apayana prasadana upachaya, in that quotation, alparetas is primary hypogonadism or primary testicular failure. Kshenaretas is testicular failure. Visuskaretas is severe oligospermia or Oat syndrome. Oligosteratospermia. Here the sperm count will not go beyond 12 million. Always it is in the level of like 2 to 8 or 2 to 12 million. That's all. And Nashtaretas word is used in the Amrita Palasruti. Nashtaretasam means like totally divide of seeds. That is also spermic samples. Yes. Here, Reaserschi component, how it is going to affect at the genetic level. Many tells like whatever you say it is there in Ayurveda likewise, right? I'm not telling that in terms of like superiority or inferiority, for the betterment of science, right? So always like one should have sarva bhutan kampaya. It should be useful to the public or patient, right? In that way, if you this single quotation is enough to understand the depth of genetic knowledge what Acharya has had. See this evam purushasya yada bije bija bhagah, which is highlighted, bije bija bhagah pradosham apadate tada vandyam janayati. I am not using the word vandya. Vandya means female. Madam already have dealt in the morning vandya. This is 1 year, right? Try to understand the grammatical word they have used. 1 year means infertile, the male infertile. That is bija bhagaha pradosham apadyante, right? So in that spermatozoa, if there is a chromosomal abnormality, right, then it is going to produce a person who is not going to have issue. Got the idea? And yada punarasya bije, in the same spermatozoa, bije bija bhaga avayavaha, not bija bhaga. Here one is bije bija bhaga, another one is bije bija bhaga avayavaha. It's part of, not the whole chromosome is missing, part of chromosome, right? Pradoshama tada puti prajam janayati. Puti prajam in the sense like cleannanga, cleannavayava, kubja, kuni, likewise. Fetal anomaly, right? And yada asya bije bija bhaga avayavaha karanam cha. Try to understand. Bija bhaga avayavaha stri karanam cha, bija bhaga avayavaha purusha karanam cha. Purusha karanam bija bhaga avayavaha is Y chromosome. Stri karanam cha bhaga is X chromosome. So this Y chromosome microdeletions in the modern science, if that is there, right, so it is going to lead, that is Purusha Karanam cha Sharira Bija Bhaganam Ekadeshaha Prapopam Apadyante, only Ekadeshaha, in that particular chromosome, if only in one part, if there is a deletion is there, missing is there, translocations are there, right, so those things Purusham Apadyante, Tada Purushakritivir Apurusham Tranaputrikam Nama Janayati. Tranapulika is different, Tranaputrika is different. Here Tranaputrika word, it is nothing but male pseudo hermaphroditism. Tranaputrika means male pseudo hermaphroditism. Okay. So this is what the explanation. The same explanation is given in the context of Vandya in females. Why Varta Utpatti takes place, why Vandya Utpatti takes place, right? We will just go through that. So this likewise this kind of genetics is explained in majority of the disorders. Wherever diabetes, they have told like there is a strong genetic predisposition in the diabetes. That is also true. That is like Kulajya Vikaraha. He has used the word Kulajya Vikaraha, right? So that is Jata Pramehi, Madhumehino Jataha. By birth, diabetes, and Madhumehino Jataha. The parents are already known case of diabetes. So likewise, the explanation is that we need to understand it properly. Yes. Next come to Reto Pariksha. Here modern science is having its advanced, and nowadays diagnostic aids have made the job very easy. Patient will come with a report. Already diagnosed cases or referred cases we are getting one part okay. What if there is no microscope? There is no phase contrast microscope, binocular or trinocular, right? How these acharyas they came to know all these factors up to genetics? That is one question, right? And they have told like very appropriately they have told like akalamnu kinikritakni dusitam, the morphological defects, right? So how the seed is going to be affected? ಈಗ ನುಸಿ ಹಿಡಿದವು ಬರ್ಬುರಿ ಆಗ್ಯಾವು ಕೀಟ ಹತ್ತೈತಿ ಮಾತಾಡ್ತೀವಿ ಬುಟ್ಟಿ ಒಳಗಿರ್ತದೆ ಬೀಜ ಬಿತ್ತಲಿಕ್ಕೆ. Okay, if they are affected in that way, similarly, how in that particular transport media, in the epidermis itself or in the cement, the quality seeds, spermatozoa is morphologically defected. Why there is like capacitation, that is like or mitochondrial defect, or sperm membrane intactness is lost, or because of hyposmatic swelling, the coiled tails, motilities. Why this kind of defects? The same is explained everything, right? See here, there were no microscope. Still the acharyas what they have told, retamsi abijani bhavanti. Retas means at the end of Ashwatha Yonihi, the oozing takes place. That is what the semen. Sarvadaika Shukra, it becomes Stanika Vecta at the end of fetus, right? Vishishta Varanga Cheshta, Sankalpa Cheshta, Sankalpa Pidana, the mechanism explained. So whatever the outcome, it comes semen. So that semen is divided. How? Retamsi abijani bhavanti, prajotpadani na samartha bhavanti. The commentator Hindu has beautifully explained in Ashtanga Sangraha, right? So that is like they had idea regarding the underlying the Shukra as a whole component. Not only they have considered the semen, they had idea that this semen is having the spermatozoa, the seeds which is required for garbhotpadana nevacha, right? So this is not like with stain or either morphology, or the directly we take a smear and we observe the motility and all, right? So we will come to know the defects, either head deformity, neck, tail, or so many deformities. The job is very easy with the help of Casano, computer assisted software. So they have given certain idea. Being a Ayurvedic physician, we need to examine with the naked eye examination. With the test tube, the sample which is brought to us should be examined with the simple gadgets, parameters. How this is like the normal Prashasta Shukra. These are the qualities of Prashasta Shukra. How these parameters can be equated with the modern seminal analysis parameters? See, Spatikabham, it looks like how it looks like. It is appearance. It indicates appearance. It's a crystal clear, right? Grayish white, the color, what we call it. Tailak Saudraniva, the consistency varies from eye, that is ghee, right? And liquid in nature, and Shukla, grayish white, Bahu, then always it should be like the volume should be more, right? And Madhugandhicha, it smells like acrid smell, and it is like taste like smells like Madhugandhi, and Avisra, right? So always Viskagandhitva is attributed to Pitta dosha, so that should not be there. And Avinahi, it should not be burning, right? And so also it should have Guru and Pichilaka. And again like subjective symptoms have been explained in the classes. At the time of ejaculation, not only the semen, at the time of ejaculation, what are the subjective signs and symptoms experienced by the patient? That should be understood by the Prashna Pariksha. So that is like Dahat Lingam, right? Kosha Chosha, right? And one variation like Kinchit Neela Pita, likewise they have told. So this, because one Acharya has told Ashtakshira Shukra Dushti in terms of based on the dosha, Another Acharya has explained on the basis of guna. Both guna and dosha assessment should be done while you are assessing the physical characteristics of the semen. So that is what Vata Pitta Gunapa Granthi Doti Koya Mutra Purisharedasa Prajotpadane na Samartha. So Shishruta Sharirasthana clearly has mentioned once the Vrishti takes place, Prajotpadane na Samartha Bhavanti. That type of sperm is not going to yes. Yes, this is like one is Shukra Drishti we need to understand within 5 minutes and going to end up. Like Vata Drishti, Pitta Drishti, Kapha Drishti, we need to understand the Shukra Shonika, the semen, how it manifests. It is secretion from majority, secretion from the seminal cycle and prostatic 30%. And the semen fructose is present, that's why the energy is utilized and sperm is fertile. Next, these are the Shukra Drishti parameters, how we need to understand. That is, Penila means frothy, Tanu means low sperm count, Ruksha means pH more than 8.5, and Alpha means volume less than 1.5 ml, and Vivarna, it is discolored, and Puti, pus more than 5 or 10, and Pichila, it is like a viscosity factor concerned here, and Avasadi, it is sedimenting. And Anyadhatu samsista, it is apart from non-spermatozoal cells like RBCs, WBCs, Pyrobacterospermia, Leukocytospermia, likewise, Granthibhuta and unliquefied semen. So this is how like we need to compare with the Spatika, normal color, etc. and observe for color and observe whether take the sample and see whether like penila is produced and bubbles remain for longer duration or what, and assess how it falls, whether it falls drop by drop or the stretchiness is more than 15 centimeter likewise. That indicates the viscosity underlying, and microscopically examine, confirm whether epithelial cells are there, pus cells are there, right, and whether it is or unliquefied even after 45 minutes if the sample is like Chingana, right? So it is not liquefied. Then, and here I have placed 3 samples side by side. You look at the first sample. Topmost here you can observe the bubbles here not. It is Tanuretus. Middle one, color is normal but Alparetus, volume is very less. The last one, the color as well as volume is that is Prashasta Shukra, right? So Tanu Retus, Shina Retus and Prashasta Retus, like this. So to address this kind of abnormalities, Ayurveda has maintained a super specialty called as Vajikarana. Long ages back, the science of Ayurveda has maintained a specialties. We can call nowadays, we can call it as like andrology OPDs, specialties. Apatya Santanakaram, yat Sadhya Samprajna. The first and foremost motto of Vajikarana itself is Apatya Santanakara. Apatya itself is Santana. Apatya Santanakara means Sudha Santanakara. Putra Pautra Pautradikam. This science is explained to take care of the seeds, quality seeds from generation to generation, right? So here, if you go to many of the Vajikarana preparations, you will come to know 2 mottos always. One is Ichche Akshayam Sukram Sekascha Uttamam Balam Yukulam Lavate Apatyam Yuva 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 Harshati Naro Apatyam Sukulam Yuva Yuva Harshati. Okay? So likewise, that is Bahu Praja concept. Bahu Prajanam Loke Pratishtha. And this is what like eugenics and epigenetic concept explained under the Vajikarana heading. That is like by means of Panchakarma and Garbha Samskara. And when we come to the clinical applicability, it is Alpa Kshina Vishishta Retasa. Here comes like Janana, Praharsha Nimitta, and Apayana. So it is before the age of 25 years. Prasadana for correction of Shukra Drishtis. Upachaya, that is advocated for Shila Shukra, and Janana Nimitta for Ati. And pharmacology of Vajikarana in terms of like Shukra Janaka, Pravartaka, all all these categories, rightly, judiciously we have to make use. So prasadana for dushtaretas, upachaya for ksheeraretas, apayana for alparetas, janana for vishishtaretas, right? And treatment principles, here Vajikarna and Rantapita Hara Yoga and Yoni Vyapaliki Chikitsa, right? And Chavana Prasha, etc. Jivani Gata, Chavana Prasha, Shilajatu, etc. Has been used. And Majja Shukra Samuttanam, Sadhu Tiktako Paramoshadam, right? And Vasti Karma Visheshataha, main Panchakarma highlighted in the context of Shukradashti, Vasti Karma Visheshataha. And even Glyca Chikitsa you can highlight here, Glyco Shatakshina, Vastayaha Kshira Sarpisha, Prashya Yogaschi Mataha, Rasayana Prayogascha Sarvan Edan Prayojane. This is what the total treatment protocol which is highlighted here. Understanding the Vajikarana Dravya in terms of Shukra Janana, like Shatavari, Musuli, etc. Shukra Pravartaka and Sutikara, right? So the drugs like Prati, Uchata, etc. Janaka Pravartaka, likewise you refer Sharanadara. And Masena Shukti Bhavati, that is Trini Panchadasha Kala Sahasrani Ekaikam Dhatu Shuddhishtati. You know how at the end of 24 days the nourishment, spermiogenesis takes place. Masena Shukri Bhavati concept. And Retusti, Vatanvite Hite Shukra Niruhasa Anuvasana. Right? This is the sloka. And Vrashavasti, Apanavasti, Kshira, Mahasarasa and Vastis are beneficial. In case of Pittaja Retusti, Virechana, Vasti and Uttarvasti are beneficial. And in case of Kapaja Shukravasti, Vamana and Kledana Vastis are beneficial. That is Magati Amrita Lihanam, right? Amrita Lohanam, Triplaya Rasayanam, Kapotitam Shukravastam, Anyat, Vallataka Rasayana is highlighted here in case of Kapaja. Anyat Samshrista. So here Yatadosham Prayinchi, based on the which dosha is associated, accordingly you use it. So and management is Virechana in case of Anyadosam Samshrista. Shukra Shodaka Ganadravas are acting like cement purifiers that can be used. And in case of oligozoospermia, so Virechana, Vrashyavasti and Uttarvasti with Palashugandha Taila and Mahamasha Taila is helpful. In case of Astigospermia, these are the drugs which are beneficial, and mainly Virechana, Vasti, Uttarvasti is beneficial, Indukanta and Kalyanaka are beneficial. In case of Teratozoospermia, Amalaki and Trivanga Basma, Rajata Basma and Purna Chandrodaya Rasa are having wonderful efficacy. Next, in case of Pyospermia, Chandana Sariva, Amalaki, Guruchi are very choice of drug, and Virechana is very beneficial. In case of azoospermia, here the job is bit difficult. It is not so easy to give a result for every patient. Here you cannot assure, but you have to do your sincere efforts. Primary azoospermia, where there is maturation arrest at secondary level, that can be treated with Ashtadasha Vasti or at least Ashtadasha Vastis we can administer. That there are few patients there that positive. And Shukra Janaka Dashyamani and Shukra Shodana Dashyamani they have told. And in case of azoospermia, the Amrita Prashakrata, in case of obstructive azoospermia, Shivaputika, Navayana and Suksma Tripala are helpful. And in case of maturation arrest, Amrita Prashakrata, Shatavari and Chavana Prashakrata are helpful. And in Ruksha Jatavasti, Vasti is the main line of treatment. And in case of Granthi Bhutaretas, Dadima and Saindava is much more beneficial in case of unliquefied semen. And in Pichilaretas, if high viscosity sample is there, so usually Loma Basma, Ashwagandha and Kapikachu are twice of drug. Remember, Ashwagandha and Kapikachu they are not Janaka drugs, but instead they help to reduce the viscosity and improve the motility. Next, sperm nutrients. Nowadays, you may be aware there is lot of scarcity in the market. Ravichandran or Hada Nuggekai may go to. Even market or Nuggekai sikta illa because everything is exported nowadays. Sperm nutrients, fenugreek sachets as a sperm nutrients are largely exported to the abroad. So that's why there is a huge scarcity in the market. And special Panchakarma modality. We tried in lots of clinical conditions that is having wonderful efficacy, you can go for it. Basti Prayoga, Chandovi Puman Bhoti Sarvashaha. 5 minutes, just 5 minutes I will find out. And it strengthens the seminal cycles. And Uttarvasti indication, like in Shukranasha, like this is what the data analysis conducted as a PG star trials and PhD trials conducted in Jamnagar, Hasan, Udupi. And here China Shukram Vajikarodi Prasham Brahmayati Stulam Karshe. This is what the benefit of Basti has been highlighted in the management of infertility. And Ashyapa, the Virechana, Bijam Bhavati Karmukam has told, the seeds become functional, right? The gonads becomes functional in the Parasruti of Virechana. And Vrashya is Bastanda Siddha Basti, directly the goat testicles, the testicles of the he goat is used in the preparation of Basti here to improve the testosterone hormone as well as to strengthen the hypoplastic testicles, right? Samanya Siddhanta. And these are the evidence-based medicine, right? That is Ashwagandha, especially helpful in hyperviscosity condition. Kapikachu is meant to increase the motility. Bokshura, especially, it adds for the testosterone and count. And Shatavari is spermatogenetic. Pokilaksha is choice of better choice in case of osteospermia with hyperviscosity. And Amalaki is administered in oligoasthenospermia as a rasayana. Ballataka is choice of drug in case of autoagglutination and asthenospermia and poor viability, right? And Sweta Musali is very beneficial in case of severe grade oligospermia. It is given. So lots of clinical trials are there, like Amalaki Rasayana and Vilechana Karma, Baladi Apanavasti and Vajikarma Yoga, right? So one explorative study we did on the effect of Vilechana Karma in the sperm mitochondrial activity. Sperm mitochondrial activity was assessed with the help of this thing, and another was methylation study, and we tried herbal rasayana, and this is what the outcome. And Uttarvasti in Libya, and Vatsayana capsule is like a Delhi based life science. We were the co-investigator for that. We conducted a phase 3 clinical trial in our institute. So I hope these are the clinical evidences. Sweta Musali, Shukragatavata, Pushpadanvarasa, Puyaretas, choke chini, choice of drug in case of pyobacterospermia, right? And role of Rajata Basma, and again like Kapikachu. So these are the clinical trials wherein like azoospermic patients, not to talk only on the Shastra based. Meantime, we need to generate evidence-based medicine, and that has to be put in the scientific forum, right? And in the meantime, we need to have a documentary so that we can prove with clinical evidences, yes, these are the result outcome of the treatment, which is explained in the Ayurveda. So here, like azoospermia with bilateral epididymal cyst and left grade 1 varicocele. So after the treatment, right? This is like Avarana Shukra, Vamana Vilechana, and Kapikachu and Sevagotica given only. So after that, 56 million was compound increase and patient conceived. And another, her partner was tubal block, diagnosed case of PCOD, right? All suggested in Belgium like IVF with donor sample, right? And treatment was given with Ayurvedic way, and we did the IUI with husband sample in our setup only, the patient conceived, right? This is what like evidence is. And another case, 99% were abnormal. This is like in case of Manipal hospital, the patient was resident of Belgium, he came to us, and after that we diagnosed 70% became normal and conceived. There are lots of even azoospermic and severe Ford syndrome cases documentary we have, right? So 25 million, 0 to 25 million, right? And see, this is the case seen by Dr. Padmini Prasad in Bangalore, I think, yes. And came with 96% this thing, and after that like 85% and 95% improvement in patient conceived. So without taking much time, so what I would like to conclude is The mere medication is not helpful. For the better management, Trayopasamba, Ahara Nidra Brahmacharya is very important. So that's why one has to give due respect to it. And meantime, the stress factor is very important. You counsel the patient properly, give them proper advice, right? And what I would like to say, like Ayurveda ages back maintained logical speciality and also focused on eugenics and epigenetics. Acharyas have tried meticulous approach to understand the male fertility factors and detailed understanding of idiopathogenesis, including genetics, without microscope, still challenges the modern advancements. And karmaphala and deriva factors, that is unexplained infertility, still today holds good. And advancement of the science. So in such cases, like Paratantravalokanam, they have told like Anuvatraha Kratavayantu Viswataha. So Paratantravalokanam is very important. So you make use of CASA or advanced diagnostic modalities, and our duty is to go for the integrated approach. We need to fill the gap. We need to create a bridge, right? So then only there is a good outcome to the society. So evidence-based medicine giving a better outcome even in comparison with the counterparts. So that's why the upcoming doctors try to concentrate on the understanding the pathology properly and make use of treatment, simple treatment protocols, and you will get the very good results. I am extremely sorry for taking 15 minutes extra time, especially for another speaker, and I thank everyone, and especially I thank for the teachers giving me this opportunity, and special thanks to Principal Sir and Melody Sir for and HOD Sir is there, ICT Sir department, so I am very kind enough for them. Thank you very much.
Thank you, sir. All the delegates are requested to, all the chits are being distributed, and all the delegates are requested to write the queries in the chits, and it will be discussed during the panel discussion. And all are requested to kindly fill the feedback forms which is present in the kit. Now it's time for the fourth scientific session by Dr. S. Vijay Kumar sir on the topic Advances in Vitro Fertilization Laboratories. I would like to welcome Dr. Vijay Kumar sir on the stage. Dr. S. Vijay Kumar sir is presently working as Assistant Professor in Department of Anatomy and Clinical, and he is Clinical Embryologist at KLE Fertility Center, KLE Street, Prabhakar Kore Hospital and Medical Research Center, Nehru Nagar, Belgavi. Sir has completed his MD in Anatomy from Bangalore Medical College and Research Institute, Bangalore. Sir has completed his Masters of Clinical Embryology from Monash University, Clayton, Melbourne, Victoria, Australia. Sir is expert in the areas of andrology consultations, clinical embryology discussion, sperm analysis, microfluidics, then ovum pickup, denudation, IUI, IVF, ICSI, and IVM. And sir is expert in embryo cryopreservation, oocyte vitrification and thawing, fresh and frozen embryo transfer, embryo biopsy. This is with a brief introduction. I would like to welcome sir to the Saaphalya 2020. Kindly proceed with the session.
Good evening, everyone. Thank you, Doctor. Let us see the last topic of the day, advances in future fertilization and its liability. Let us know the first IURVEDIC medium, that's the Durga, which was born on the year 1978 on October 3rd, and the pioneers behind this are Dr. Subhash Mukherjee, the gynecologist, and Dr. Sunit Kumar Mukherjee, the embryologist, first embryologist of India. Let us see the first IURVED in the world, that's Louis Brown, which was born in the year 1978 on 25th July. The pioneers behind this are the Robert A. Byrd, the gynecologist, and the Patrick Steptoe, the British gynecologist, and the Robert A. Byrd, the British zoologist and the physiologist, who was the pioneer behind creating the human embryo and giving them the live birth. And for this, the great thing that is the going behind the nature, they have been honored with the highest award in the world, that is the Nobel Prize in the year 2010. Since morning we are seeing that many factors have been affecting the infertility. In that, the 30% is the male factor and the 30% is the female factor, and 30% is the combination of the both the factors, and the 10% is the unknown factor, where we also can't even know that whether it's a female part having the problem or the male part having the problem. And every couple who is coming to the clinic, they require a complete solution, and they don't want to go with any empty-handed, and the pressure falls from the clinician hands to the embryologist hand. And you need to give whatever the type of the egg or whatever the type of the sperm the couple give, we need to give a 100% success. Is it possible? No. Only 30 to 40% of the IVF cases lead to the complete pregnancy, and in IUI, only 10 to 15% of the couple will lead to the pregnancy. So, and what you are seeing there is the embryo and the IVF lab. So, an high-tech IVF lab should have a class 10,000 air quality, which is purest air which is present in the laboratory, and it should have minimum amount of dust particles. Minimum means nothing. You should not find any dust particles inside the IVF laboratory, and all your linings should be clean and washed every day. And even the food waste what you are wearing should be VOC free, and the paint what we are seeing the IVF lab is also the VOC free. And IVF lab is considered as the life or the sacred part of the art of the IVF, where the incubators are considered as the uterus, which mimics the growth of embryos, growth of whose gametes, post-fertilization into the development of into the embryos till the day 3 or the day 5, or until you transfer inside the uterus. So, let us see the advances in the following areas. You all know that once the eggs or the sperm which is being deposited or transferred to the embryology lab, I can't do much in the IVF laboratory. I can just manipulate, or I can try my level best to give a good quality embryo as an outcome. So, the following are the areas what we can see here. The identification of good quality oocytes. One, post-oocyte retrieval, we should always identify the good morphologically mature oocyte, which will give you a good embryo at the end of the 5th day or 3rd or the 5th day of the development. Identification of a good sperm, fertilization, embryo culture, identification of embryo for transfer, cryopreservation of surplus embryos and the gametes on the uterus. We all know that what is this IVF? We know that IVF is nothing but hyperstimulation of the oocytes, where we can get more than 6 to 10 oocytes, and out of the 6 to 10, I need to segregate only the mature oocytes, that is the M2 type of oocytes, which are helpful for me to inject one egg, one sperm, or segregating the mature oocytes for culturing them inside the IVF culture dish, where I can transfer only the motile morphologically good sperm into the culture dish. But in IVM, where the couples where the female partner is having the other type of pathological conditions, where I can't do ovarian stimulation, in those type of patients, I need to go with IVM, where I don't stimulate the oocyte only. I just, according to the menstrual cycle, at the 8th or the 10th day of the menstrual cycle, I just take out the oocytes. Oocytes are nothing but the germ cells or the graphene which are very, very immature and very, very tiny. We all know that oocytes are measuring a size of 120 microns, but in IBM, these size is even more smaller when compared to the regular size of the oocytes. The factors or the patients who need to be segregated for IBM only exclusively are polycystic ovarian syndrome, where the patients who are already faced ovarian hyperstimulation syndrome, or patients who need to preserve their oocytes, that is for fertility preservation, or who are already undergoing treatment for cancers, or patients if they are in the higher age group or the advanced maternal age, or their AMH is very much low or less than 1 or 0.5, they need to be treated for IVM. What do I do here? I take out the small anther follicle, primary follicle or the secondary follicles. I will culture them in my culture dishes inside the laboratory for at least for 30 to 48 hours, where I will again first I will check for the maturity of few sets of oocytes, whether it is matured in my laboratory or not, matured in my incubator. Then if it is mature, I will take them out and take one sperm and one egg. I will inject one sperm inside one mature egg, so that I can leave it for fertilization for the rest of the period. If it is not mature, again I will keep those immature oocytes inside the laboratory, inside the incubator again. I will again check for the second last time, post 48 hours after oocyte retrieval, and again I will check it. If the oocytes are mature, I will utilize them as the second set of oocytes, mature oocytes, and again I will do the ICSI, intracytoplasmic sperm injection, so that the second set of oocytes may fertilize and then culture till day 3 or day 5. Usually, IVM embryos are cultured till day 3 of the period. So, day 3 of the period. So, you can see here. So, where all those IVM oocytes are very, very small in size, and they are cultured in the culture media, where I will add some additional micronutrients which are helpful for the maturation of the oocytes in the culture dishes. Most of the IVF oocytes, only if the main factor is having any issues, that is oligospheroteratozoospermia or spheroteratozoospermia, I will subject them for ICSI. If they are normo or teratozoospermia and their majority of the sperms are motile, then I will subject them for IVF. Coming for the main factors are the identification of the sperm. ICSI. What is this ICSI? ICSI is intracytoplasmic sperm injection. That is, one mature egg is taken and the one morphologically motile sperm is immobilized and injected inside the ooplasm. So, do I do this for all? Yes. No? No. Only ICSI is subjected only for the male factors who are considered as oligospheroteratozoospermias or asphenoteratozoospermias or cryptozoospermias. Cryptozoospermia is nothing but less than 1 million. The count is less than 1 million. For those type of patients, I consider doing ICSI. Or oligospheroteratozoospermia, I will consider doing ICSI. If I have a large amount of sperms, motile sperms, I need to select only a good morphologically looking sperm, so that the developing embryo is very beautiful. So I can't, if I have a choice, I need to select only the morphologically good looking sperm. In the second abnormal sperm, you can see a egg defect there. You can see a large vacuole present in the upper end of the egg. In the first picture, you can see the normal morphological egg. In the other three, you can see the vacuole or the damage in the nucleus or the acrosome part of the egg. And in the last picture, you can see the mid-piece defect, where all the last three eggs, last three sperms are not selected for doing the ICSI. Only the first sperm, which is looking morphologically normal, only that sperm is selected and injected into the mature oocyte. The second one, PIXI. What is this PIXI? A physiologically intracytoplasmic sperm injection. In this dish, where you can see this is a modified dish, where the dish bottom is coated with hyaluronic acid. You can see the yellow dots there. That dot is being coated with hyaluronic acid. In the previous lecture, you have heard that the DFI index, DNA fragmentation index, where man in the stress has already stressed a lot, it will lead to damage or arrest of the previous stage embryo, or it may lead to the development of poor quality oocytes, which may implant and may lead to abortion or recurrent implantation failure or recurrent pregnancy losses. So, to prevent those type of those type of incidences, my lab is again given an advanced technique where I can select only the morphologically good sperm. I can't see the defect of the sperm egg, but by looking at this dish where the morphologically good sperm and its egg get stick to the yellow dot. The yellow dot is the hyaluronic acid. Only the morphologically good sperm, which is having a normal DNA, only that sperm will get stuck to the yellow dot of the dish, and I will pick that only yellow dot sperm, the sperm which is stuck to the hyaluronic acid, to inject into the mature oocyte. Now coming to the other technique, microfluidics. In this technique, again, every time only the male factor who is having the DNA fragmentation index behind 15% and above, we can select this microfluidics technique where the count motility and morphologically is above 5 million, and it's having a motility of at least 10 to 15% motile sperms. We can use this technique. What does this do? I have taken a raw sample which is already liquefied, and I have taken into the syringe and I am loading into the device. The device is called as Zymote. It's a marketing term, and the device is called as microfluidics technique. It uses the fluidic technique where the center well is having a thin layer of membrane which filters the abnormal sperms and also the immotile sperms. Beneath it, only the motile morphologically normal sperms will float above the membrane there, and only the normal motile sperm which have been floated above the membrane will be picked up by me, and then I can subject it to IUI or IVF, or I can do ICSI. The latest advanced one, where again there are many techniques to sort out the DNA fragmentation index, DNA fragmented sperms, but all the methods are very pricey except the one PIXI dish. This method is called as magnetic activated cell sorting. That's called as MAX. Where you can see the blue color is a high capacity magnet, where in that I have inserted a tube, and inside that tube I will load a annexin coated raw semen sample. That annexin coated raw semen sample will have both abnormal sperm and also a normal sperm. Abnormal sperm is nothing but a sperm which is already having a DNA damage inside its nucleus or head of the sperm. So those abnormal sperms get attracted towards the magnet, which is having the annexin field, will get attracted towards the magnet, and only the normal motile sperms will get floated down the membrane, floated down the tube. So I will collect those motile sperms and I will use those sperms to perform intracytoplasmic sperm injection. As sir said, the CASA. CASA is nothing but the computer-assisted sperm analysis. There are various types of CASA available in the market. The latest advance and the recent one which has been invented by the Italians is the SQA Vision, where you will get all the parameters as sir suggested in the previous slides. The sperm analysis, volume, physical parameters, morphological parameters, and also the egg defects, tail defects, and all those things, including it will also give you the DNA fragment index till what level it is present inside the sperm volume. But the limitation is the sperm, this CASA machine can only analyze the sample behind 2 to 3 millions. But below that, if the male partner is having a severe OATZ, or if the male partner is having tryptospermia, those type of cases will be neglected in this type of machine. Coming to the surgical sperm retrieval techniques, it is the surgical sperm retrieval techniques. The first and foremost is the teaser. Where do we do these surgical sperm retrieval techniques? Do we do it for all the male patients? They will definitely know they don't agree for going under the knife. Where we need to do this? Only for the azoospermia cases where you feel like hormonal levels are normal. Then you need to analyze physical analysis, physical examination. Then you need to see whether the gonads are normal, that is the testes are normally placed inside the scrotum, and post that you need to examine the epididymal and the vas difference. If there is any absence of the vas, you can give an impression like it's an obstructive type of azoospermia. Even if the vas is present, then it's a type called as non-obstructive type of azoospermia. So, in the green colored table, what you are seeing is the teaser, testicular sperm aspiration. I am using a butterfly-shaped needle, where I will do just a fine needle aspiration biopsy and take the seminiferous tubules from it, and I will tease those seminiferous tubules, so that whatever the sperms or the spermatids present inside the seminiferous tubules are teased outside. I mean, it's pushed outside the lumen of the seminiferous tubules, so that whatever the motile sperms are, you will not find any motile sperms there, because most of the spermatids are motile only when it comes to the epidermal part. All the immotile sperms are present, or immature sperms are present inside the testes. So I will take them out and I will again process it, and I will collect only the morphologically good looking sperms to do the intracytoplasmic sperm injection. So in the second technique, if I don't find any sperm in the TZ technique, I need to open the testis and I need to collect at least a point pinch of the testicular sample. Then I will tease the testicular sample, so that I may find at least 1 or 2 sperms, so that I can give a best result to the couple. So that procedure is called testicular sperm extraction. The latest of this technique is microsurgical testicular sperm extraction. In the first picture, where you can see the andrologist is doing a microtesticular sperm extraction. He is using the eye magnification binocular microscope. He is opening the complete testis. He is finding the normal architecture of the testis, and he is leaving out the fibrous type of testis. He will search only the normal architecture of the testis. From there, he will cut small pieces and he will give it to us. If you find any sperm, we can use that sperm immediately to inject the egg. As the ma'am said, Dr. Desai ma'am said in the morning that out of 12 eggs, 6 were fertilized and 6 converted into blastocyst, and she conceived with the twins. So this was the technique where the couple were subject for microtesticular sperm extraction under the microscope, and the success rate in this microtesticular sperm extraction is just 5%. Just 5%, where you can expect a normal motile sperm. Coming to the next subsection, fertilization. Now, we have subjected the oocyte and the sperm, and we are expecting the fertilization. When we need to see this, we need to see the fertilization post 18 to 20th hour of the insemination or injection inside the oocyte. So, if you see two nucleus, one is the male pronucleus and another one is the female pronucleus, that is the normal one. If you see more than two pronucleus, then it's considered as abnormal fertilization. So, what you need to do is, I will eliminate those abnormal type of fertilized embryos or the zygotes, and I will culture only the normally fertilized zygotes till the day 3 or the day 5 of the culture. By eliminating this, you can increase the success rate of the pregnancy of the couple. Now, embryo cultures. There are different types of embryo cultures. We have seen from the past they were group cultures. Now it has been coming to the single embryo culture. Now there are so many pros and cons in both the methods, group culture and it's also in the individual embryo culture. In the group culture, there are so many paracrine or apocrine factors which will help in exchange of any deficit amino acids or the pyruvate or the glucose with one another embryos, but it is not seen in the same way in the single embryo culture, where even if it is having any deficit in its own amino acids or the glucose or the lactate, it has to develop by breeding without any pyruvate or the lactate. But the advantage of single embryo culture is you can identify, you can culture post freezing or the post transfer of that embryo. You can subject that media, the culture media, for the pre-implantation. The DNA testing, where the media can be assessed for the quantitative analysis of the metabolites which are present in it, and comparing with the normal embryo which is having the different amount of quantitative analysis of the metabolites. Even the protein present within that embryo culture media can also be analyzed, and it will also give you the better result without doing any biopsy of the embryo. Embryo culture media. Till 2020, we had a different type of culture medias, where for every step of the culture, we need to use a different type of culture media. For example, before taking, while doing the oocyte retrieval, we need to culture those oocytes in the fertilization media. Then, post day 1, we had to culture the embryos inside the cleavage media till day 3. Post day 3 to day 5 or day 6, we had to culture those embryos again in the different type of media that's called as blastocyst media. All those 3 different types of media had different composition of metabolites, proteins, amino acids and the lactates within each. So, all those 3 different types of media represented the fluid present inside the fallopian tube and the uterus, and also at the end of the femoral end of the fallopian tube. But the advanced one is monophasic culture media, where you can use only a single culture media which is having all components of your uterine or the fallopian tube media in it. So you have an enormous amount of glucose, lactate, pyruvate, and other amino acids and the proteins which are supposed to nourish the developing embryo. You can see the advanced machine. This is called as time-lapse imaging or the embryoscope, where if you want to see how if any couple wants to know how is our embryo has developed from day 0 till day 5, he or she can see the images like this. In the A image, you can see the fertilization. In the B image, it's nothing but the day 1, where you can see the 2-cell stage. This machine takes an image of the complete development of the embryos at regular intervals. That is at least 15 minutes once. It will click the images and stores in its memory. So whenever you want to go back and see whether it has developed properly or whether there was any delay in the development or there was any fast development, you can also see by going back to the that image. The third image, C, you can see there, you can see 3 cells, 3 blastomeres. D is nothing but the second day. E and F, you can see it is between the 3rd and the 4th day. G, you can see it's the 4th and the 5th day. 4th day, 97th hour is the 4th day, that is called as morula. 5th day and the 6th day. You can see H and the I, it's called as early blastocyst and the complete blastocyst. You can see at the 3 o'clock to 5 o'clock position, you can see a complete inner cell mass. That's a very good A-grade quality embryo. If you transfer that A-grade quality type of embryo, you can surely expect 100% success, provided the uterine lining and the uterine endometrium is of normal thickness between 8 mm to 12 mm. Omics. As I said earlier, by doing the single embryo culture, you can analyze the quantitative measurement of the metabolomics and also the proteomics which are present, which are released by that embryo into that medium. This can be subjected for analysis of any genetic diseases or any chromosomal abnormalities or any other things. Now, identification of embryos for transfer. Laser assisted hatching. Most of the advanced IVF laboratories have adopted laser assisted hatching. It's not doing anything much. It's just making a small hole in the zona pellucida, in the zona pellucida. Why you need to do this? Only a selected case of embryos which are having thick zona, we can subject them for zona thinning or small zona, laser assisted hatching, and creating a small hole within the zona. By creating this small hole, you are just enhancing the success rate of implantation. By what does it do? It will start in the A picture. You can see at the 4 o'clock position, we have just created a small hole by laser assisted hatching, and you can see in the B at 2 o'clock position, you can see small herniation of the blastomeres outside it, and you can see in the image C and D already in the 2 o'clock and 3 o'clock position, you can see the complete, 30 to 40% of herniation has already happened within the blastomeres have come out of the zona. This helps in easy implantation. You don't have zona pellucida is nothing but the shell of an egg. You can see the egg. The white thing, what you are seeing is the zona pellucida. You need to break that zona, and then only the blastomeres, which are very sticky, just gets out and gets attached, gets stick to the endometrial lining. Single embryo transfer.
As we all know that many of the IVF centers, they just transfer more than 2, 3, 4 number of embryos inside the uterus, and they give just a chance. Whichever the embryo is viable, it gets stuck to the uterine endometrium. But if we see the health of the female, if she is cachexic or if she is very lean, and or if she is having preoccupied diseases like hypertension or gestational diabetes, we can't transfer more than 1 embryo. She might give a live birth more than 3 kgs of baby at the time of delivery. So it's better not to go for fetal reduction, go for a single viable best grade A or grade B type of embryo and transfer it inside the uterus. Usually the conversion rate of day 3, if you have a 3 good day 3 embryos, it will give 1 good day 5 blastocyst. So remember, if you want 1 day 5 A grade or B grade embryo, you need to have at least 3 good cleavage stage embryos. So to get converted into a single embryo or singleton transfer, we recommend to transfer 3 day 3 embryos or 1 day 5 embryo. If you have what if you have an embryo beyond day 5? If you have an embryo beyond day 5, you need to freeze that embryo, again synchronize the uterine endometrium to the day 5, then you transfer it back to the uterus. Now coming to the advanced technique called as pre-implantation genetic testing. We all know that post-ovarian stimulation, the oocytes are retrieved out and it is done, the IVF or ICSI is done in the laboratory, and then embryos are cultured till day 5 or day 6. Post day 5 or day 6, if the embryos are converted into a blastocyst, I select each and every blastocyst and take out at least 5 blastomeres out of each embryo, and then subject each and every embryo sample for next gen sequencing. This next gen sequencing will help in analyzing the aneuploidy rates and also the mitochondrial diseases and also the structural chromosomal rearrangement, if any, present inside the embryos. They also can give you the mosaic pattern if the mosaicism is low, high or very high, or if it is negligible. Post receipt of the report, only the normal euploid, single euploid embryo needs to be transferred inside the uterus. Cryopreservation. The latest advanced technique is the cryopreservation, where the ovarian tissue can also be cryopreserved. Cryopreservation is mainly done where to preserve the fertility of the individual, whether it's a male patient or the female patient, or the couple is in the advanced maternal age, or the male partner is in the military, but his female partner wants to continue the process of progeny. She can undergo the rest of the cycle of IUI or IVF by preserving the male sample. And moreover, the recent advances for cryopreservation is where the female is having any type of benign or the malignant cancers, and she is subjected for the chemo or the radiotherapy. If a female or a male partner is subjected for chemo or the radiotherapy, we can expect there is damage to the gonads or the gametes. You can't produce the same quality of oocytes or the sperms which you had been producing before the chemotherapy. So it's better for all the partners who are about to go for chemotherapy or the radiotherapy to preserve their ovarian tissue or the oocytes, seminal tissue or the semen, adequate amount of the semen samples before going for chemo or the radiotherapy or any of the type of cancer therapies. What you are seeing here in the first picture is the ovarian tissue. We have already sliced the ovarian tissue and we are subjecting it to at minus 196 degrees Celsius and freezing each and every slice of ovarian tissue in the liquid nitrogen. And we are freezing it. We can freeze that sample for at least 5 to 10 years as per the Indian law. Similarly, the oocytes, where the single women or the women who are more oriented towards the career, like the film actors or the actresses, they can preserve their oocytes at the age of 20 to 25. Then they can complete their career. Post 30-35 years, they can get married, a suitable guy, and they can continue their project. Similarly, in the testicular sample, testicular biopsy. A testicular biopsy can be frozen both in azoospermia patients or in the tryptozoospermia patients or the patients who are having a very high BFI index of more than 50 to 75. They can freeze their testicular sample and we can use that sample for further utilization of the motile sperm for doing ICSI. In this picture, you can see the semen sample. The raw semen sample is frozen by using the cryoprotectant and frozen at minus 190 degrees Celsius. That frozen sample can be utilized for intrauterine insemination or for IVF. Excess embryos. As I said earlier, you can transfer single best embryo inside the uterus. If a couple wants to, if a couple has got more than 2-3 embryos, what they need to do? Do they discard it? No. For the consecutive pregnancies, she can transfer one embryo and the rest of the embryos she can freeze it and keep it dormant in the hibernation state in the liquid nitrogen at minus 196 degrees Celsius. Later, post failure of the transfer or post conceiving or post delivery, she can come back and get to transfer the remaining embryos post 2-3 years. So that is called as cleavage of blastocyst embryo cryopreservation. What about the what are the other factors which we can enhance from our laboratory research? In the patients like thin endometrium or low AMH patients, we can inject autologous blood sample. We take out the autologous blood sample. We filter we extract platelet-rich plasma. We inseminate the platelet-rich plasma inside the uterus, so that for at least 2 to 3 attempts of platelet-rich plasma will give you a good result of endometrial lining of around at least 5 mm. In AMH patients who are having very low AMH, if we can also inject the platelet-rich plasma directly to the ovaries. It will also help in enhancing the AMH value. But the results are still in the nascent stage. They are not satisfactory. Similar to endometrial, we know that post fertilization at the 18th or the 19th day, whose embryos get implanted inside the uterus. But most of the time there is recurrent implantation failure. Why does it occur? There may be a pre-receptive or the post-receptive of the endometrium. There may be the implantation window may already crossed the time, or it may have not crossed the time. Usually it will be on the day 5 post-fertilization. So by doing the endometrial biopsy on the day 5 or the day 6 of the dummy cycle of the embryo transfer, we send that sample for RNA extraction. With that RNA extraction, we do next-gen sequencing. By doing the next-gen sequencing, we can analyze that whether the uterine endometrium is its receptivity window is opening on the day 5 or the day 6 or behind the day 6 or on the day 4th of the endometrium or the secretory phase of the endometrium. So, depending on the report, we need to synchronize the cycle so that there is no chance of recurrent implantation failure. So the future of IVF lies in the stem cells of spermatogonians, oogonians, and the embryonic stem cells. So, thank you.
Thank you, sir. Now I request Dr. Sandeep G. Patil, sir, Professor, Department of Panchakarma, to present certificate to sir. Thank you, sir. Now I request today's resource persons to come over the stage. The delegates who are having any queries, please come over the stage and discuss. Now it's panel discussion. Delegates who have any queries, please come over the stage.
ಅದರ ಕಲರ್ ಚೇಂಜ್ ಮಾಡಿ ಬ್ಯಾಕ್ಗ್ರೌಂಡ್ ಚೇಂಜ್ ಮಾಡಿ ಬ್ಯಾಕ್ಗ್ರೌಂಡ್ ಚೆನ್ನಾಗಿದೆ ಆ ಕಡೆ ಈ ಕಡೆ ಇಲ್ಲಣ್ಣ ಅದ್ರಲ್ಲ ಮತ್ತೆ ಅಂದ್ರೆ ಅದ್ರಾಗೆ ಇಬ್ಬರು ಇನ್ನೊಂದು ಸ್ವಲ್ಪ
There is a query by the delegate, sir. How can we understand about difference between Shukravrita Vata and Shukragata Vata?
Very good question asked by you. One thing is like in case of Shukra Gatavata, Gatavata concept, based on Vata Gata concept. Wherever Vata goes to particular site, like Indriya Gata, Kosha Gata, like Gatavata concept. And also, when it reaches the Dhatus respective Rasa Gata, Rakta Gata, like So when Shukra Dhatu and Vata resides in the Shukra Dhatu particularly, it attains Shukra Gatatva, Shukra Asrita. So in such conditions, Tatra Shukra Gata Vata concept, it leads to the either premature ejaculation condition. In case of Shukra Gata Vata, Badnati Shukram Munchati Shikrameva, right? Either it obstructs Shukra, so that is either delayed ejaculation or early ejaculation. So it is more of ejaculatory disturbance is concerned. Whereas in case of Shukraprata Vata, we come across the Avarana concept here. So in case of Avarana concept, Shukravrate, Nishpalatvancha, here they have used the word Nishpalatva. So because of the Avarana condition, so there what happens the semen sample is devoid of seeds. So that's why it is unable to fertilize. So that's what Nishpalatvancha. In case of Shukravrata, it is Avarana concept, whereas Shukra Gata Vata concept, it leads to ejaculatory disturbance. So that is what the main difference explains.
Thank you, sir. One more question is, these days azoospermia cases are more. Does it depend on Prakriti of a person? And if done, the treatment aspect of doctor should be concentrated on what factor?
See, again the concern with azoospermia, the question raised. So here azoospermia in relation with Prakriti. So always Bahupraja, the concept related with Prakriti, Alpa Kesha, Krasho, Ruksho, in that concern, when it comes to Shukra Sara or Shukra Sara Prakriti is also told, and Shukra Sara Lakshana has been Ksira Pura Lochana, etc. They have rightly explained. And when it comes to Kapha Prakriti person is always Stri Priya and Bahupraja, etc. Whereas Alpa Prakriti, that is Vata Prakriti person, so Alpa Praja word has been used. So that's why similarly in case of Vata and as well as in case of Pitta Prakriti individuals, the Praja concept, that is issues are, there is comparatively less, whereas Shukra Prakriti, Kapha Prakriti and Shukra Sara individuals are naturally having the essence and quality seeds. They are having capacity to have the more number of Praja in comparison. And in case of Vata Prakriti person, always there is more scope to have the azoospermia state of infertility. So that that Vata Prakriti individual, when we assess the prognosis, nacha tulle uno dosho no dosha Prakriti bhave. So there the Prakriti as well as the aggravated Prakutita dosha is Vata. So hence the Vata individual is having more scope for having that azoospermia state immediately. That is Alpa, Ksina, Vishishka and Nashtareta. So that Nashtareta state we are going to notice more in case of Vata individuals rather than in the Kapha Prakriti individuals. Because the Vata Prakriti person, the Vata is going to lead the Sampya Dhatu Kshaya.
Sir, what is the concept behind spermatogenesis and Shukrotpatti?
Spermatogenesis, sir is going to answer. Shukrotpatti, when we talk of Dhatu concept, starting from Rasa to Shukra, Prinanam, Jivanam, Lepaha, Sneho, Dharana, Purane, Garbhotpadasya Karmani. So Garbhotpadana Karma is attributed for Shukra Dhatu. So when we talk of it is Saptama Dhatu, the seventh Dhatu in our body. So the Mula Shukra was Shrotas, Mula Sthana is Prashanam. So in that particular testicles, the Vrashana, the testicular tissue, the basic component of Shukra Dhatu, tissue proper, when we call of tissue proper, so that is having the germinal epithelium. From there, exactly the bija utpatti, that is the spermatogenesis with the process of like mitosis, meiosis, etc. And finally, the spermatozoa utpatti takes place. And in case of like epidermal, the storehouse, the spermiogenesis takes place. So I think it is the basic physiology, how that is the process of Shukra Utpatti concerned. Even though it is like Sarvadahika Shukra we call, when it comes to Sthanika Shukra, the semen, the production of the semen is considered as transport media here, and it provides nutrients for the healthy seeds. Whereas in that particular semen itself, the billions and trillions of spermatozoa are embedded, and that is what the Acharya Charaka, he tells Rupa Dravyam Taduchate. He attributes the word special term for quality seeds, that is Garbhotpadaka Bija is called as Rupa Dravya because it is carrying the genetic makeup of one individual to the offspring. So I hope this is the process of Shukrotpatti, and the physiology explained is like Vyavaya Kale, Harshotha Yono, right? Retasaha, the Retas Utpatti, Sarvadayika under the influence of hormones, the gonadal secretions, in the form of gonadal secretion, what it comes out is called as Retas, that is semen and Bija. We need to understand the meaning of words like Retas and Pumbija. So I hope I am clear with that.
Spermatogenesis is nothing but a division of the germ cells till the spermatogonia. Spermiogenesis is nothing but from the spermatogonia till the way the morphological changes happens, that is shedding of the cytoplasmic droplets, and everything will happen in the epidermis. The spermatogenesis will happen within the testes and the seminal vesicles.
Any delegates are having any questions? Thank you, sir. Now it's time to felicitate Dr. Sukumar Nandikauda, sir. I request sir to come up to occupy the seat on the to occupy the seat, and I request the faculties to join to. Now it's valedictory session. First, Dr. Aishwarya, PG scholar, to share her opinion about Saaphalya.
First of all, I
here for conducting such a good seminar. Actually, infertility is a burning issue nowadays, and our Ayurveda has a multiple Ayurveda treatment modalities, and success rate is high. I thank all the research persons to sharing their valuable knowledge. Thank you all. Thank you, Ayush. Now I call upon Dr. Nasima, which is correct, to share their opinion.
Good evening, dear respected dignitaries on the dais and off the dais and all delegates. So, Saaphalya is about beginner approach to the infertility. From morning session to still now is so much useful, and it creates the knowledge about how to get about the infertility, and it has so much confidence about our practice. And by this, we can know about infertility and advanced research about infertility. So I was so grateful to our beloved principal, professor, and all staff and all technicians. Thank you.
Thank you, Nasima. Now I call upon Mr. Avinash, finally a BMS student, to share his opinion.
Good evening, everyone. Saaphalya 2022. Yesterday, I watched one movie known as Vicky Donor. First of all, I used to think why this movie is so weird. When I passed the PUC first year, I came to know that there is a sperm count is a burning issue in the society. So when I joined the Saaphalya seminar, I would like to say only one word about Saaphalya. Fruitful. Very fruitful. Why it was very fruitful? Because we came to know different modalities about Ayurveda, how the Ayurvedic is managing the infertility problem. In the same, and also in the parallel, we came to know about the modern accept, how we treating the infertility cases by using different methods such as IVF, CASA, and embryo culture, such methodologies. So, last word, it was fruitful. Thank you.
Thank you very much. Now I request Dr. Jairaj P. Bashlikar, sir, Professor and HOD Department of Panchakarma, to announce the prizes of poster and oral paper presentation sessions.
Good evening, everybody. So at last we are lined up the Saaphalya since morning. We are hearing all of the talks. So now it's time to announce best papers. We have two best papers has to announce. The first one is Dr. Madhuri Goda, Ayurvedic Mahavidyalaya, Hubli. Top one from the class. She is receiving the 1,000 rupees cash prize. So another best paper, Kripa Thomas, Sri College of Ayurveda, Bangalore. I think she is not there. On behalf of her, somebody can receive it. Now it's time to announce post-presentation prizes. So I would like to say that to the dignitaries on the dais, our fourth year students enthusiastically involved and they prepared the posters innovatively because that they have involved in this session. So third prize goes to Nikita and Pooja, Ishtika Sweda. Third prize, Nikita and Pooja. Pavitra Patil and Bhatya Kamar, Patra Potli Sir. First prize goes to Amrita HM and Asriya Sultana Parisheka.
Now I request Dr. Ingrid Pulsar, Principal, to speak few words.
ಬೆಳಗಿನಿಂದ ಇಲ್ಲಿವರೆಗೆ ತಾವೆಲ್ಲ ಬಹಳ ಆಸಕ್ತಿ ಮತ್ತು ವಿಶೇಷ ಮುತುವರ್ಜಿಯಿಂದ ಈ ಕಾರ್ಯಕ್ರಮದಲ್ಲಿ ಪಾಲ್ಗೊಂಡಿದೆ. ಎಲ್ಲ 4 ಅತಿಥಿ ಉಪನ್ಯಾಸಕರು ನಮಗೆ ವಿಸ್ತೃತವಾಗಿರ್ತಕ್ಕಂಥ ವೈಜ್ಞಾನಿಕವಾಗಿರ್ತಕ್ಕಂಥ ಅಪರೂಪದ ತಮ್ಮ ಪ್ರಾತ್ಯಕ್ಷಿಕ ಜ್ಞಾನವನ್ನು ಹಂಚಿಕೊಂಡಿದ್ದಾರೆ. ತಾವು ಕೂಡ ಬಹಳ ಖುಷಿಯಾಗಿದೆ ಅಂತ ಭಾವಿಸಿದ್ದೇನೆ. ಒಂದು ಕಡೆ ದೇಶದ ಜನಸಂಖ್ಯೆ ಹೆಚ್ಚಾಗ್ತಿದೆ, ಅದನ್ನು ಕಡಿಮೆ ಹೇಗೆ ಮಾಡಬೇಕಂತ ಚಿಂತನೆ ನಡೆದರೆ ನಾವೆಲ್ಲ ಹೇಗೆ ಏನು ಜನಸಂಖ್ಯೆನ ಹೇಗೆ ಮಾಡಬೇಕು ಅನ್ನೋದು ನಾವು ಚಿಂತನೆ ಮಾಡ್ತಾ ಇದ್ದೀವಿ. ಆದರೆ ಇದು ನೋವಿನಿಂದ ಬಳತಕ್ಕಂಥ ದಂಪತಿಗಳ ಒಂದು ಅವರಿಗೆ ಸಂತಾನ ಪ್ರಾಪ್ತಿಗಾಗಿ ಮಾಡಬೇಕಾದಂತಹ ಒಂದು ಚಿಕಿತ್ಸೆಯ ಹೊರತಾಗಿ ನಾವು ದೇಶದ ಚಿಂತನೆಗೆ ವಿರುದ್ಧವಾಗಿ ಚಿಂತನೆ ಮಾಡ್ತಾ ಇಲ್ಲ. ಆದರೆ ಎಷ್ಟೋ ತಂದೆ ತಾಯಿಗಳಿಗೆ ಸಾಕಷ್ಟು ಆಸೆ ಇರ್ತದೆ, ಮಕ್ಕಳಿರ್ತದೆ, ಅಲ್ಲ ಮಕ್ಕಳನ್ನು ಹೊಂದಬೇಕನ್ನೋ ಆಶಯ ಇರ್ತದೆ. ಆ ಆಶಯದ ಮಧ್ಯದಲ್ಲಿ ಅವರ ಕೊರಗನ್ನು ನೀಗಿಸುವುದಕ್ಕೋಸ್ಕರವಾಗಿ ಆ ದಂಪತಿಗಳಿರತಕ್ಕಂಥ ಸಮಸ್ಯೆಗಳನ್ನು ಅರಿತುಕೊಂಡು ಆ ಸಮಸ್ಯೆಗೆ ಸೂಕ್ತವಾಗಿರ್ತಕ್ಕಂತಹ ಪರಿಹಾರವನ್ನು ಕೊಟ್ಟರೆ ಆ ಕುಟುಂಬವು ಕೂಡ ಸಮೃದ್ಧ ಆಗ್ತದೆ. ಅದ್ರ ಜೊತೆಗೆ ಈ ವಿಶಿಷ್ಟ ನಾನು ಹೇಳಿದ ಹಂಗೆ ಈ ವಿಶೇಷವಾಗಿರ್ತಕ್ಕಂಥ IVF-ನಲ್ಲಿ ಅಥವಾ ಇನ್ನೊಂದು ಬೇರೆ ಕೃತ್ರಿಮವಾಗಿರ್ತಕ್ಕಂಥ ನಾವೇನು ಚಿಕಿತ್ಸೆಯಿಂದ ಬಂದಿರತಕ್ಕಂಥ ಸಂತಾನಗಳು ಹೆಚ್ಚು ಬಹಳ ಜಾಣ ಮಕ್ಕಳು ಕಂಡದನ್ನು ನಾನು ಕಂಡಿದ್ದೇನೆ. ಅದು ಕೂಡ ಒಂದು ಭಾಗವಾಗಿರ್ಬೋದು ನಾನು ಅಂದೇನೆ. ಆದರೆ ಇಷ್ಟು ಮಾತ್ರ ಒಟ್ಟು ಈ ಏನಂತ ನಾವು ಟೇಕ್ ಹೋಮ್ ಮೆಸೇಜ್ ಏನು ನಾನು ಹೇಳಬೇಕಾಗಿತ್ತು ಅಂದ್ರೆ, ಇವತ್ತು ಆಯುರ್ವೇದ ಅಂದ್ರೆ ಎಲ್ಲ ರೋಗಗಳ ಡಾಕ್ಟರ್ ಹಾಕಿನ ಅನ್ನೋ ಒಂದು ಭಾವನೆ ಇರ್ತದೆ ನಮಗೆ. ಅದು ಬಹಳ ತಪ್ಪು ಕಲ್ಪನೆ. ನನ್ನ 30 ವರ್ಷದ ಅನುಭವದ ನಾನು ಹೇಳ್ತಾ ಇದ್ದೇನೆ. ಎಲ್ಲ ರೋಗಗಳ ಚಿಕಿತ್ಸೆ ಮಾಡೋ ವೈದ್ಯರಾಗಬೇಡ್ರಿ, ಒಂದು ರೋಗವನ್ನು ಚಿಕಿತ್ಸೆ ಮಾಡೋ ವೈದ್ಯರಾಗ್ರಿ. ಆದರೆ ಆ ರೋಗವನ್ನು ಚಿಕಿತ್ಸೆ ಮಾಡಬೇಕು ಅಂದ್ರೆ ನಾವೆಲ್ಲ ಭಾಳ ಜನ ಇಲ್ಲಿ ಮುಂಜಾನೆ 200 ಜನ ತುಂಬಿಟ್ಟಿತ್ತು. ಅದರೊಳಗೆ ಈ ಉಳಿದಿರೋರು 70-80 ಜನ ಅಷ್ಟು ಉಳಿದಿರಿ. ಅವೆಲ್ಲ ಜೊಳ್ಳೆ ಕಾಳು ಆಹಾರ ಹೋಗ್ಯಾವ. ನೀವೆಲ್ಲ ಗಟ್ಟಿ ಕಾಳು ನೀವೆಲ್ಲ ಗಟ್ಟಿ ಕಾಳು ಏನಾದರೂ ಮಾಡ್ತೀವಿ ಅನ್ನುವಂಥ ವಿಶ್ವಾಸ ನನಗಿದೆ. ಕೊನೆ ಕ್ಷಣಕ್ಕೂ ನೀವು ಕೂತಿದ್ದೀರಪ್ಪ ಅಂದ್ರೆ ನಿಮ್ಮಲ್ಲಿ ಏನಾದರೂ ಒಂದು ಸಾಧನೆ ಮಾಡಬೇಕಂತಕ್ಕಂಥ ಸಂಕಲ್ಪ ನಿಮ್ಮಲ್ಲಿದೆ ಅಂತ ನಾನು ಭಾವಿಸಿದ್ದೇನೆ. ಖಂಡಿತವಾಗಿ ನೀವು ಅದನ್ನು ಸಾಧಿಸ್ತೀರಿ ಅಂತ ನನಗೆ ವಿಶ್ವಾಸ ಕೂಡ ಇದೆ. ನಾನೇನು ಹೇಳಬೇಕಾಗಿತ್ತು ಅಂದ್ರೆ, ಆಯುರ್ವೇದ ಚಿಕಿತ್ಸೆ ಒಂದು ದಿನದಲ್ಲಿ, ಒಂದು ವಾರದಲ್ಲಿ, ಒಂದು ತಿಂಗಳಲ್ಲಿ ಯಶಸ್ಸನ್ನ ಕಾಣೋದಿಲ್ಲ. ಯಶಸ್ಸು ಬರಲಿಲ್ಲ ಅಂತೇಳಿ ನೀವು ಯಾರು ನೆಗೆಟಿವ್ ಆಗೋ ಅಗತ್ಯಗಳಿಲ್ಲ. 1 ಬಿಟ್ಟು 10 ಬಿಟ್ಟು 100 ಬಾರಿ ನೀವು ಪ್ರಯತ್ನ ಮಾಡಿದಾಗ, 100 ಬಾರಿ ಪ್ರಯತ್ನ ಮಾಡಿದಾಗ ಒಂದು ಯಾವ್ದು ಯಶಸ್ಸು ಆಗ್ತದೆ ಜೀವನದಾಗ. ಹಂಗೆ ಯಶಸ್ಸನ್ನ ಕಾಣ್ತಾ ಹೋದಂಗಿಲ್ಲ. 1 ವರ್ಷ, 2 ವರ್ಷ, 3 ವರ್ಷ, 4 ವರ್ಷ, 5 ವರ್ಷ ಆದ್ಮೇಲೆ ಒಬ್ಬರು ರಿಕಗ್ನೈಸ್ ಆಗ್ತೀರಿ. ನಾನು 20 ವರ್ಷಗಳ ಚಿಕಿತ್ಸೆ ಮಾಡಿದ ಮೇಲೆ ಒಬ್ಬರು ರಿಕಗ್ನೈಸ್ ಆಗ್ತಾರೆ ಇಡೀ ರಾಜ್ಯ ತುಂಬ. ಹಾಗೆ ನೀವು ಕೂಡ ರಿಕಗ್ನೈಸ್ ಆಗಬೇಕು ಅಂದ್ರೆ ನಿಮ್ಮ ಪ್ರಯತ್ನ ಮತ್ತು ನಿಮ್ಮ ವಿಶ್ವಾಸ ಸೈನ್ಸ್ ಮೇಲೆ ಇರ್ತಕ್ಕಂಥ ಸಂಪೂರ್ಣವಾಗಿರ್ತಕ್ಕಂಥ ನಂಬಿಕೆ ನೀವು ಇಟ್ಕೊಂಡು ನೀವು ಸಂಶೋಧನಾತ್ಮಕ ಮನೋಭಾವದಿಂದ ತಿಳಿದದ್ದನ್ನು ಪ್ರಯೋಗಿಸೋದು, ತಿಳಿಯದ್ದನ್ನು ಕೇಳಿ ತಿಳಿದುಕೊಳ್ಳುವುದು, ತಿಳಿದುಕೊಂಡು ಪ್ರಯತ್ನಿಸೋದು, ಇವು ನಿಮ್ಮ ಜೀವನದ ಮೌಲ್ಯಗಳಾಗಬೇಕು. ಅಂದಾಗ ಮಾತ್ರ ನೀವು ಜೀವನದಲ್ಲಿ ಯಶಸ್ಸನ್ನು ಸಾಧಿಸಲಿಕ್ಕೆ ಸಾಧ್ಯತೆ ಐತಿ. ಆದ್ಮೇಲೆ ಆಯುರ್ವೇದದಲ್ಲಿ ಸಾಕಷ್ಟಿದೆ. ಒಂದೊಂದು ರೋಗದ ಮೇಲೆ ಒಬ್ಬ ಡಾಕ್ಟರ್ ಆಗ್ಬೋದು. ನನ್ನ ಅಭಿಪ್ರಾಯ ಹೇಳ್ತೇನೆ, ಸುಮಾರು ಒಂದು 30 ರೋಗಗಳನ್ನು ಖಂಡಿತವಾಗಿ ನಾವು ಶುದ್ಧ ಆಯುರ್ವೇದ ಚಿಕಿತ್ಸೆ ಮಾಡಲಿಕ್ಕೆ ಸಾಧ್ಯತೆ ನನ್ನ ಅನುಭವದಾಗ. ಒಬ್ಬೊಬ್ಬರಿಗೂ ಒಂದೊಂದು ಅನುಭವ ಇರ್ತದೆ. ಈ ಫೀಲ್ಡಲ್ಲಿ ನಾನಿಲ್ಲ, ಈ ಫೀಲ್ಡಲ್ಲಿ ನಾನಿಲ್ಲ, ನನಗೆ ಗೊತ್ತಿಲ್ಲ. ನನಗೇನಾದ್ರೂ ಈ ಥರ ಕೇಸ್ ಬಂದ್ರೆ ಇಂಥ ಡಾಕ್ಟರ್ ಹೋಗಿ ಇಂಥ ಡಾಕ್ಟರ್ ಹೋಗಿ ಅಂತ ಹೇಳ್ತೀನಿ. ಹೊರತಾಗಿ ನಾನು ಒಂದು ಔಷಧಿ ಕೊಡಲ್ಲ. ನನಗೆ ಸಾಕಷ್ಟು ಔಷಧಿ ಬರ್ತದವ ಕೊಡಲ್ಲ. ಯಾಕಂದ್ರೆ ನನ್ನ ಫೀಲ್ಡ್ ಅಲ್ಲ. ನಾನು ಹಂಗೆ ಬೆಳವಣಿಗೆ ಆಗಬೇಕು ಆಯುರ್ವೇದ ವಿಜ್ಞಾನ ಅಂತವನು. ಹಂಗನೇ ಬೆಳವಣಿಗೆ ಆದ ಮಾತ್ರ ನಿಮ್ಮ ಜೀವನದಲ್ಲಿ ಯಶಸ್ಸಾಗತ್ತೆ. ನಾನು ಅದಕ್ಕೂ ಔಷಧ ಕೊಡ್ತೀನಿ, ನಾನು ಇದಕ್ಕೂ ಔಷಧ ಕೊಡ್ತೀನಿ, ಯಾವ ಔಷಧಕ್ಕೂ ಆರಾಮಾಗಲ್ಲ, ಯಾವ ಔಷಧಕ್ಕೂ ಯಶಸ್ಸು ಸಿಗಂಗಿಲ್ಲ. ಹಾಗಾಗಿ ಆಯುರ್ವೇದದಲ್ಲಿ ವೈಫಲ್ಯತೆಯನ್ನು ಪಡೆಯಲಿಕ್ಕೆ ಕಾರಣ ನಾವೇನಪ್ಪ ಅಂದ್ರೆ, ಒಂದು ದಿಢೀರನ್ನೇ ಒಳ್ಳೆ ವೈದ್ಯರಾಗಬೇಕು, ದಿಢೀರನ್ನೇ ಸಾವುಕಾರ ಆಗಬೇಕು, ದಿಢೀರನ್ನೇ ಕಾಲು ತಗೋಬೇಕು, ದಿಢೀರನ್ನೇ ನಾವು ಮಕ್ಕಳಿಗೆ ನರ್ಸಿಂಗ್ ಕಟ್ಟಬೇಕು ಅನ್ನೋಂಥ ಆ ಆಸೆಗಳನ್ನ ಇಟ್ಕೊಳ್ಳದೆ ಒಳ್ಳೆ ಆಯುರ್ವೇದ ವೈದ್ಯರಾಗಬೇಕಂತಕ್ಕಂಥ ಉದಾತ್ತ ವಿಚಾರವನ್ನು ಇಟ್ಕೊಂಡು ಬೇರೆ ಮೇಲೆ ಪ್ರಯತ್ನ, ಬೇರೆ ಮೇಲೆ ವಿಫಲ, ಬೇರೆ ಮೇಲೆ ಪ್ರಯತ್ನ, ಮೇಲೆ ಮೇಲೆ ಯಶಸ್ಸು ಸಿಗ್ತದೆ ಅಂತಕ್ಕಂಥ ಮಾತನ್ನು ಈ ಸಂದರ್ಭದಲ್ಲಿ ನಮಗೆ ಹೇಳ್ತಾ, ಆಯುರ್ವೇದದಲ್ಲಿ ಅಗಾಧವಾಗಿರ್ತಕ್ಕಂಥ ಶಕ್ತಿ ಇದೆ. ಅದನ್ನು ಆಳವಾಗಿ ಅಧ್ಯಯನ ಮತ್ತು ಪ್ರಾತ್ಯಕ್ಷಿಕ ಜೊತೆಗೆ ನಾವು ಪ್ರಯತ್ನ ಮಾಡಿ ಈ ಸೈನ್ಸ್ ಅನ್ನ ಮುಂದೆ ಕೊಂಡೊಯ್ತಕ್ಕಂಥ ಜವಾಬ್ದಾರಿ ನಿಮ್ಮ ಮೇಲಿದೆ. ನಾವು ವಿ ಆರ್ ಇನ್ ದ ರನ್ನಿಂಗ್ ರೇಸ್ ಅಥವಾ ರಿಲೇ ರೇಸ್. ಆ ರಿಲೇ ರೇಸ್ನಲ್ಲಿ ನಾವು ಓಡ್ತಾ ಇದ್ವಿ. ಇದು ನಾವು ನಮ್ಗೆ ಎಷ್ಟು ಕೊಟ್ರ ನಾವು ನಿಮ್ಗೆ ಎಷ್ಟು ಕೊಡ್ತೀವಿ. ನೀವು ಇದು ಹಿಡ್ಕೊಂಡು ಓಡಬೇಕಾದ ಅಗತ್ಯತೆ ಇದೆ. ಆಧುನಿಕ ಜಗತ್ತು ಇವತ್ತು ಆಯುರ್ವೇದವನ್ನ ಬಹಳ ತೀಕ್ಷ್ಣವಾಗಿ ನೋಡ್ತಾ ಇದೆ, ಬಹಳ ಸೂಕ್ಷ್ಮವಾಗಿ ನೋಡ್ತಾ ಇದೆ. ಅದರಿಂದ ಆಯುರ್ವೇದಗಳಿಗೆ ಒಂದು ದೊಡ್ಡ ಪಟ್ಟ ಏನಂತಂದ್ರೆ ಅಲೋಪತಿ ವ್ಯಾಖ್ಯೆ ಮಾಡ್ತಾರ. ಅಲೋಪತಿ ವ್ಯಾಖ್ಯೆ ಮಾಡ್ಕೊಂತ ಇಲ್ಲ, ಆಯುರ್ವೇದವನ್ನ ಆಯುರ್ವೇದ ಉತ್ತಮವಾಗಿ ನೀವು ಚಿಕಿತ್ಸೆ ಮಾಡಿದ್ರೆ ನಿಮ್ಗೆ ಯಶಸ್ಸು ಸಿಗ್ತಕ್ಕಂಥ ಮಾತನಾಡಿಸಿದ ವೇಳೆ ನಮ್ಮ ಭವಿಷ್ಯ ಉಜ್ವಲವಾಗಲಿ. ಬಂದಿರ್ತಕ್ಕಂಥ ಅತಿಥಿ ಅಭ್ಯಾಸಕ್ಕೆ ಮತ್ತೊಮ್ಮೆ ವಂದಿಸಿ ನನ್ನ ಮಾತನ್ನು ಮುಗಿಸ್ತೇನೆ. ಧನ್ಯವಾದ.
Thank you, sir. Now it's time for national anthem. It is being arranged outside and all are requested to come in.